The theme of the webinar is Principles of Teaching in Nursing Education. We have selected this theme because when a teacher combines the effective principles of teaching with some strategies, the student will be able to learn more effectively. These strategies will provide students with more opportunities and will also improve their performance if we maintain all the principles of teaching while we take the class. Now I would like to introduce our speakers. Dr. Priscilla Sampson, ma'am, Professor and Principal, Era College of Nursing, Lucknow. Ma'am will be talking about classroom teaching. Dr. Sheila Tiwari, ma'am, Principal, Bora Institute of Nursing, Lucknow. Ma'am will be talking about lab demonstration. Professor S. Balamani Bose, Principal, LLRM College of Nursing, Merit. Ma'am will be talking about clinical demonstration or teaching. Professor K. Maheshwari, ma'am, HOD, Community Health Nursing Department, SCPM, College of Nursing, Gonda. Ma'am will be talking about community teaching. Now I would like to request Dr. Priscilla Sampson, ma'am, to kindly take her session.
Okay, good afternoon, everyone. Am I audible?
Yes, ma'am, you're audible.
Okay. So, good afternoon, and once again, I would like to thank Dr. Alok Kumar, the Secretary of UP State Medical Faculty, and also Dr. Neetu Devi, Nursing Consultant, for giving me this opportunity to share, some thoughts about classroom teaching, which we already know, and this will be just a, kind of throwing highlight, so that what we have forgotten or what we are not doing, we'll be able to again continue doing it for the betterment and raising the quality of nursing education. So for my topic, are you sharing my slides? Okay, thank you. So classroom teaching, as we all aware, it's a first place for our nursing students when they enter, our college or school of nursing. It's the first place that they go before they even go to the skill labs, or they go to the clinical areas. Is the first place. So it is very important for us to focus on their classroom teaching. Next slide, please. So just before we go on to what it is and how we should do what tips of classroom teachings are, just a brief things about teaching and learning. As we all know, and these are certain some definitions which are old, but they are very much relevant even in today's scenario. Like Burton, he says that teaching is the stimulation, guidance, direction, and encouragement of learning. तो यहाँ हम देखते हैं कि जो teaching है, उसमें teaching से ज़्यादा teachers के role पे highlight किया गया है. As the teachers, we need to stimulate our students. और stimulation के बहुत से तरीके. It's not the boring lecture we are going to give in the classroom. गाइड कैसे करना है स्टूडेंट्स को, उनके उनके उन कोर्स में कैसे गाइड करना है, फ्यूचर के लिए करियर कैसे उनका गाइड करना है, डायरेक्शन कैसे देना है, एंड वेरी इंपॉर्टेंट व्हिच इज माय फेवरेट वर्ड हियर इज द एनकरेजमेंट ऑफ लर्निंग. हाउ वी कैन एनकरेज अवर स्टूडेंट्स एंड हाउ वी कैन मेक इट मोर इंटरेस्टिंग फॉर देम, ताकि वो इंकरेज हो अपने लाइफ में और सीखने के लिए. क्लास से भी एक डेफिनेशन दी है जिसमें कि दे टॉक अबाउट, हियर जो वर्ड जो कैची वर्ड है वो है एक्टिविटीज. Teaching refers to activity. It is again not something you go and deliver in the classroom and come back, but it is activities that, so classroom has to be very active. Active learning should take place in the classroom. So, and here our main aim is to change the behavior of the modification. So if you have seen earlier also, education brings the modification in one's behavior. When we say behavior, it could be, not only academic, उन्होंने पढ़ाई किया, रट्टा लगाया और एग्जाम दे दिया. But when we say change in behavior, it's the overall development of our students. So जैसे कि वो आते हैं first year में, they have no clue about blood pressure. It's a simple example. We teach them उनका skill, that is also a behavior, a skill that they're gaining, knowledge they're gaining, and also the attitude, how they're communicating with the patient while checking the blood pressure. So all these things, how we can change their behavior also and attitude also. Next slide, please. Now, Israel and Scheffler also, they also talked about activities. The same thing, And also it has to be, what I want to focus in definition, this definition is that we need to also integrity and capacity. We have to respect that because each student is a different person. Each student has a unique, personality, and we have to, as a teacher, we have to tap on those. उसको हमें देखना कि इन बच्चों में, हमारा बच्चा, हमारा क्लास 100 बच्चों का क्लास है या 60 बच्चों का क्लास है, उनका इंटेलेक्चुअल कैपेसिटी, उनका इंटरेस्ट क्या है, और उस पर टैप ऑन करना है, वही वो टीचर है, और वो टीचिंग में, क्लासरूम टीचिंग में हमें हेल्प करता है. नेक्स्ट स्लाइड प्लीज. Now, few principles of learning that I would like to say. There's somebody called Rosenshine, and Rosenshine was a educational psychologist, and they have given some list of, principle of the classroom teaching or instruction that we call. उसमें से सबसे पहला है interaction between students and teachers. Now ये बहुत ज्यादा बेसिक मेन प्रिंसिपल, पहला प्रिंसिपल ये लिखा है कि कैसे हम इंटरैक्ट, ये नहीं लिखा है कि कितना हम उनको डिलीवर कर रहे हैं, कितने पेजेस ऑफ नोट्स उनको दे रहे हैं, कितनी डेफिनेशंस दे रहे हैं, बट इट इज अ इंटरैक्शन बिटवीन टीचर स्टूडेंट्स. ओके, student interaction. Student interaction is, again, it is, here we can do like group dynamics. There are certain students who don't feel comfortable in like बड़ी सी भीड़ में उनको कुछ पूछ लो, उनके सीखने में भी वो शाय होते हैं, कुछ शर्माते हैं, कुछ बोल नहीं पाते हैं, मे बी उनका कम्युनिकेशन स्किल उतना एडवांस नहीं है. तो स्टूडेंट इंटरेक्शन को भी जब हमने प्रेजेंटेशंस देते हैं, ग्रुप वर्क देते हैं, those are the things that is one of the principle of classroom instruction. Active learning, as I have already said, activities, अगर activities नहीं है, आपका क्लास एकदम dull है, you are not going to achieve good results and your objectives. Time on task is very important. टाइम ऑन टास्क इज, हमारे स्टूडेंट्स को ये जानना जरूरी है कि उनके पास कितना टाइम कौन सी एक्टिविटी के लिए है. तो वो गाइड्स टीचर्स को करना है, टीचर्स को बताना है कि ये दिस इज वेरी एसेंशियल, इस पे ज्यादा टाइम लगाओ. एक डेफिनेशन रटने में आप 1 घंटा 2 घंटा लगा देते हो, इज इट रियली नीडेड, और यू नीड टू नो व्हाट आर द स्टेप्स and how to do it, what are the crucial things, कौन सी most important चीज है जो बच्चों को आना चाहिए competency gain करने के लिए. So time on task, and also जब हम उनको पढ़ाते हैं, उन्होंने लिया, हमने मार्क कर दिया, खत्म हो गया. वी हैव टू कॉल देम इंडिविजुअली टू आवर केबिन एंड वी हैव टू टेल देम कि बच्चा आपने ये आपके स्ट्रेंथ्स थे, आपने ये अच्छा किया, इसमें आप इंप्रूव कर सकते हैं. सो दैट रैपिड फीडबैक जो होता है, जो फीडबैक होता है, दैट इज अ वेरी, और आगे मैं आपको बताऊंगी कि रिसर्च ऑल्सो हैज बीन डन जिसमें स्टूडेंट्स ने उन टीचर्स को ज्यादा अप्रिशिएट किया है जिन्होंने उनको रैपिड क्विक फीडबैक दिया, ताकि that will help them. Then communicates high level of expectations of the students' ability to learn. हमेशा टीचर को, चाहे वो आपके कैसे भी स्टूडेंट्स हैं, you have to tell them that you have to have a certain expectations in life. यानी कि बस आए और किसी तरीके से पास होके स्ट्रगल होकर के निकल गए, but tell them to keep some expectation. आप जितना हायर एक्सपेक्टेशन रखोगे उतना you will be able to achieve. इसका मतलब ये नहीं है कि हम बच्चों पे बर्डन डाल दें, और उनसे वो सब करवाएं जो शायद वो नहीं करना चाहते हैं या नहीं एबिलिटी है उनमें, लेकिन still we need to tell them that they can have a high expectations. Last one here is the respect of for different talents, ways of learning. ये मैं और elaborate करूंगी अपने आने वाले slides में. So respect for different talents, as I said कि हमारे जो batches हैं, हमारे बच्चे जो हैं, especially I'm very proud to say that our nursing students are really talented. I'm sure कि आप लोगों के colleges में भी आप देखते होंगे कि बच्चे जब extra curricular चीजों में participate करते हैं, co-curricular activities में participate करते हैं, you can see that and you will be amazed. अरे हमने कभी सोचा नहीं था बच्चा इतना अच्छा कर लेगा. So and also we need to say जिसमें जो काबिलियत है, उस काबिलियत को हम कैसे और निखार के आगे बढ़ाएं. That is what Next slide. Okay, thank you. Now here, let us ask some H questions. We always talk about WH questions when we are doing research. लेकिन यहाँ भी teachers का role जो है, whom to teach. Again, we are talking about diversity of students. I'm going to take this in, for each point we are going to discuss in the next slides. Diversity of students. So students is the one we are teaching. लेकिन उसमें सारे student एक जैसे हैं, so we will see that. Why to teach? यहाँ पे आता है कि हम कैसे अपने ऑब्जेक्टिव्स जो हैं, हम अपने यूनिट के ऑब्जेक्टिव्स बनाते हैं, अपने लेसन प्लान में ऑब्जेक्टिव्स बनाते हैं. व्हाट आर आवर डिजायर्ड ऑब्जेक्टिव्स, व्हाट टू टीच. तो यहाँ पे आता है जो कंटेंट हम यूज करते हैं पढ़ाने के लिए, उसमें मास्टरी ओवर कंटेंट है एज अ टीचर की नहीं, कि हमने बस इंटरनेट से उठाया कुछ भी और सीखे. वी आर लर्निंग एट एवरी फेज. वेयर टू टीच, अप्रोप्रिएट सेटिंग. हम लोगों ने बहुत से इंस्पेक्शंस कराए होंगे अपने अपने कॉलेजेस में. अभी रिसेंटली QCI के यहाँ सबका हुआ है, उसके पहले होते रहते हैं, पीरियोडिक मेंटर का हुआ है. We know that setting जो है वो बहुत important है. How our students, are we making them comfortable? I know it is not possible कि 100% उनको comfort दिया जाए, but what are they able to focus when they are in classroom? Classroom की सफाई है कि नहीं है? All those other things also we will see in our coming slides. Next slide, please. So here we see diversity of students. There are a lot of things that make students different from each other. Family background है, schooling है, socio-economic background होता है, temperaments होता है. कोई बच्चे introvert होते हैं, कोई extrovert होते हैं. Personality जो है, जो जानते हैं, आप लोगों ने पढ़ा है साइकोलॉजी में भी, पर्सनालिटी तरीके की होती है. एक्टिव होते हैं कुछ लोग, पैसिव होते हैं कुछ, एंड ऑल्सो कुछ परफेक्शनिस्ट बच्चे भी होते हैं, कुछ एग्रेसिव होते हैं, एंड ऑफ कोर्स ओवरऑल देयर इंटेलिजेंस में भी काफी एक दूसरे से फर्क हो सकता है. सो जब एज ए टीचर जब मैं क्लास में जाती हूँ, मैं ये नहीं कह सकती कि अरे इस बच्चे के जैसे ही सबको बनना है. एंड बहुत बार हम टीचर्स ये गलती ये करते हैं कि हम एक बच्चे का उदाहरण दे देते हैं और कहते हैं इनसे सीखो, इससे सीखो, जब ये कर सकती है तो तुम भी कर सकते हो. These kind of comments जो है वो बहुत ज्यादा डिमोटिवेट करते हैं हमारे बच्चे को. लैंग्वेज भी सम इश्यू हो सकते हैं. पता है, हम लोग इंग्लिश बहुत कभी कभी यूज कर लेते हैं, हो सकता है बच्चों को समझ में नहीं आ रही है. इंग्लिश जरूरी है बिकॉज उनको पढ़ना इंग्लिश बुक्स है, लेकिन English should not become a barrier for any child to language, whether it's English or Hindi or जो भी language हो, language जो है कभी भी learning के लिए एक barrier नहीं होना चाहिए, and that is the responsibility of our teachers. Okay, next slide. Desired objective, as I said, everybody talks about smart objectives, but are they really a smart objectives when we are making? बहुत सालों का एक्सपीरियंस है मेरा टीचिंग का, एंड आई फाउंड दैट पीपल डोंट नो हाउ टू राइट डिजायर्ड ऑब्जेक्टिव. जब हमारे ऑब्जेक्टिव ही नहीं लिखे रहेंगे सही, तो कुछ भी सही नहीं जाएगा. तो दैट इज व्हाई वी इंसिस्ट अ लॉट अबाउट डिजायर्ड. हम क्या चाहते हैं? ये क्लास मैं 1 घंटे की ले रही हूँ, आफ्टर 1 hour ऑफ दिस क्लास और आफ्टर कंप्लीटिंग दिस यूनिट, मेरा क्या ऑब्जेक्टिव है कि मेरे बच्चे सीखें या ये कर पाए, किस लेवल पे वो आगे बढ़े. So that is very much important, and I'm not going to take a class here about how to write objective because it's altogether a different, there's a whole, and I think हम ये क्योंकि ये faculty group है, यहाँ students नहीं है, so faculty is very well aware. Nursing is ऐसा subject है, I think health sciences में, जिसमें कि हम लोगों को इतने घंटे nursing education पढ़ाया जाता है. So I'm not going to take class on that, but I'm just saying कि हम लोग ने सब पढ़ा है, लेकिन उसको implement हम लोग नहीं कर पा रहे, and that is why these sessions have been organized. Also जब हम objectives बनाते हैं, always check the syllabus. Syllabus में क्या दिया हुआ है, ठीक है? Because lot of times you will get, your objectives from there. And sequential, orderly. आप जब suppose you are teaching any डिजीज कंडीशन, अगर आप पहले ट्रीटमेंट पढ़ा देंगे और बाद में आप बताएंगे कि इंट्रोड्यूस करेंगे, डिफाइन करेंगे व्हाट इज दैट डिजीज कंडीशन, दैट इज नॉट गोइंग टू मेक एनी सेंस. तो इसीलिए सीक्वेंट ऑर्डर होना चाहिए एंड दैट ऑर्डर शुड बी फ्रॉम सिंपल टू कॉम्प्लेक्स. नेक्स्ट स्लाइड. थैंक यू. सो कंटेंट. नाउ कंटेंट बहुत इंपॉर्टेंट है जो हम डिलीवर करने जा रहे हैं. So again, as I said, it should be based on the syllabus, but not limited to the syllabus. Syllabus जो revision जो होता है वो हम हर महीने या हर साल में भी एक बार हम इसे not possible, क्योंकि syllabus का जो revision है it takes a process, it takes a long time, you know, it takes a lot of effort. So as a health personnel, as teachers, as faculty, we should be aware कि हमारे societal changes क्या हैं, हमारे needs क्या हैं, कोई new disease has occurred. So you know, don't keep your thing to very limited जो दिया हुआ है. आप लोग ने सिलेबस देखा होगा, आपको कभी कभी लगता है अरे ये चीज नहीं है, मिसिंग है, इट शुड हैव बीन एडेड. अगर आपको लग रहा है कि इट शुड हैव बीन एडेड, पास ऑन टू योर स्टूडेंट्स. यू नो, आप अपना होमवर्क करिए, हो सकता है बुक्स में नहीं हो, आप पता करिए, जर्नल्स देखिए, मेहनत करिए. तो इसीलिए do not ever do that. You know, I have seen some faculty who is doing that, those kind of things. So avoid doing that. Use simple language जब अपना plan बना रहे हैं. Grammar, you know, these are the things that students also catch on. So that means आपको time लगाना. कभी कभी क्या होता है, faculty will say कि मैम रात में हमने बनाया है lesson plan. That is very kind of, no, it's not a right thing. आप रात में 2-3 बजे तक अपना lesson plan बनाएंगे when you have time to prepare and deliver that content. So all those things we need to keep in mind, and preferably tight. We have to be very organized when we are preparing the content before we deliver it. Next slide, please. Avoid copy and paste, जो बहुत देखने को मिलती है. Plagiarism भी इसको बोलते हैं हम लोग, है ना. So दूसरों का बस लिया और पेस्ट कर दिया और पढ़ा दिया. Okay. So और कभी कभी इतनी देर में बनती है कि पढ़ने का टाइम नहीं मिलता, मीनिंग भी खुद को भी नहीं पता होता, स्टूडेंट्स को भी बता नहीं पाते कि लिखा क्या है स्लाइड्स पे. So please do not do that. You know, so this is advice for new faculty as well, because new faculty is very much into, you know, searching the net and getting the things from there. So आप लोगों के लिए भी है कि do not do everything. You cannot copy and paste. And preparation, as I said earlier also, mastery over content. आपके पास होना चाहिए mastery over content, so that when your students are intelligent, students will always ask you questions. You should be well prepared to answer. लेकिन जो मैं ये भी चीज कहना चाहती हूँ, every answer to every question you want, क्योंकि कभी कभी faculty also may not know. तो उस समय क्या है कि हमें बोलना है ऑनेस्टली कि बेटा आज हम नहीं बता पाएंगे, हम आपको कल इसका भी बताते हैं या कल इसके बारे में बताते हैं. इससे आपकी रिस्पेक्ट बच्चे के नजर में कम नहीं हो जाएगी. बट इफ यू गिव देम अ रॉन्ग आंसर, द इंटेलिजेंट स्टूडेंट विल गो एंड चेक. तो कहेगा मैम ने मुझे गलत इंफॉर्मेशन दी. दे विल नेवर ट्रस्ट यू. जो इंटेलिजेंट नहीं होंगे, जो बेचारे एवरेज और बिलो एवरेज होंगे, वो देखेंगे भी नहीं और वो लाइफ लॉन्ग के लिए गलत चीज सीख जाएंगे. So it's always to say, I will tell you tomorrow. If you don't know, if you're not sure of the answer, always provide clinical, practical, real life experiences. Nursing is full of real life experiences because that is what our profession is. And हम जो faculty है वो हमारे पास ample number of experience है. Student life का भी experience हो सकता है जो नए faculty है. Faculty जो अभी seniors है उनके पास अपना बहुत lifetime experience है. So it's always good to give example and practical, you know, examples to our students. And reference is a very, very important part. जो भी हम ले रहे हैं उसका reference students को देना है, because content you cannot give everything to students. So they will go back, they will read on it. Next slide, please. Teaching, learning methods and technology. मुझे इसके बारे में ज़्यादा क्या बोलने की ज़रूरत है, because I know that today, especially new faculty and new students, they are very much aware of the new technology and methods used. फिर भी हम देखते हैं कि हमारे अभी भी प्रोफेशन में कई स्कूल्स में कई जगहों पे वही रूटीन लेक्चर मेथड चल रहा है. लेक्चर मेथड इज नॉट रॉन्ग, बिकॉज देयर आर टाइम्स व्हेन वी नीड टू यूज लेक्चर मेथड, स्पेशली व्हेन स्टूडेंट्स आर न्यू, दे हैव नेवर बीन इन नर्सिंग. बट उसके साथ हम और क्या यूज करें, ठीक है. सो वी नीड टू think about that and also consider the group size. आपका group size 100 है और आप एक चार्ट पेपर बना के ले आए, the student won't be able to see also, so we need to keep those principles of AV8s in our minds. At least two. These guidelines are also given in the mentor program that UP State Medical Faculty has started, initiated. At least two audio visual aids, excluding the white or blackboard, that needs to be there. Multimedia approach we need, PowerPoint for larger group. This all we know, but we don't do. There are still people who go, they are not able to prepare the PowerPoint. Okay. And they just go and talk from their lesson plan, which is in their hands. After knowing also, we are not following. That is the sad part. इसलिए ये जो अभी जो सेशंस हो रहे हैं वो इसलिए नहीं हो रहे कि हम आपको नॉलेज इम्पार्ट करें, ये इसलिए हो रहे हैं कि हम देखें, इवैल्यूएट करें कि वेयर आर वी मिसिंग, हमें और क्या करने की जरूरत है, अपने टीचिंग को कैसे इफेक्टिव बनाएं. नेक्स्ट प्लीज, नेक्स्ट स्लाइड. And every classroom should have a online Wi-Fi facility. So if you need to show online videos, बीच बीच में आप video clips भी दिखाएंगे, that will keep the group very focused. और बहुत concentrate बच्चे करेंगे. Then to have a monotonous 1-1.5 घंटे का lecture, and I've already said कि हम ये सब चीजें अपने में use कर सकते हैं. Gaming and simulations are becoming a part now of medical health sciences, even in nursing, even in era. University, we have gaming programs. This year we have started for our BSc students, and it's very interesting for them to have been engaged in these kind of things. Case studies, just take an example of any patient. If you're teaching a disease condition, you can discuss about that. And these are some teaching learning methods and aids. So ये पूरा जैसे होता है ना मसाला, you have ingredients in your cooking. It's the same for a classroom teaching. The much masaledar, ingredients that you will have, the much better effect you will get for our students. Next slide, please. Appropriate setting, as I said, these are the environmental factors that we need to know. Sometimes I go to the class, just a class, and I see कि curtain कहीं से hang हो रहा है, कहीं नीचे गिरा पड़ा है जमीन पे, किसी ने देखा ही नहीं, खिड़कियां बंद है, स्टूडेंट बैठे, फैकल्टी भी बिना ऐसी क्लास ले रही है. So we are only focused कि आओ अपना जो पेपर लेके आए हैं उसका लेक्चर दो और निकल जाओ. I'm not aware bothered कि कहाँ पे क्या हो रहा है, कहीं पानी गिर रहा है या कहीं बच्चे को क्या हो रहा है, कहीं कुर्सी टूटी है. These are सिर्फ ये मेंटेनेंस स्टाफ का काम नहीं है. When we are faculty, the moment I enter the class, I need to observe my surroundings and see कि सब ठीक ठाक है कि नहीं है. That is very much important. Functioning of LCD projector, we have to, before we come for class, अगर आपके पास कोई LT अटेंडेंट है या नहीं है, तो you need to check कि भैया प्रॉपर फंक्शन हो रहा है कि नहीं हो रहा है, क्लासरूम में मार्कर है कि नहीं है, इरेजर है, डस्टर है कि नहीं है. ये सब टीचर की भी रिस्पॉन्सिबिलिटी. ऑफ कोर्स you can ask the class monitors to, students also should know how to have a good environment, but we need to initiate it, we need to encourage it. Next slide, please. Now there are certain quick tips for classroom teaching, very important. Some may be repeated, I will not go through them. Teachers' appearance and grooming should be very pleasant. I have taught for more than 25 years in my life, and I think that this is very, important for a teacher, how she presents herself before her students. So, how you groom, because you are a role model, not only in your teaching, but overall, students are watching over you. इसका मतलब ये नहीं कि आप heavy makeup करके आ जाए, but you should be presentable. They are learning from you. Remember that. Have a high quality lesson plan. Lesson plan के लिए भी we can take class for 2-3 hours and even more. But if you don't know how to make a lesson plan, there are a lot of guides. Please learn and make a proper lesson plan. So if you have interest, ask your seniors also, and you can make this plan. Always begin a lesson with a short review of previous learning. बहुत important है. पहले आपके क्लास में क्या हुआ उसके ऊपर आप ब्रीफिंग क्विज ले लीजिए, लास्ट क्लास में ये पढ़ा था, लेट्स हैव अ क्विक क्विज, स्टूडेंट एंजॉय दैट, उसको मत डालिए इंटरनल असेसमेंट में, बट जस्ट एटलीस्ट दे विल नो कि हमारे लिए क्विज होगा, दे आर वेरी एक्साइटेड। क्रिएटिव वे टू इंट्रोड्यूस अ न्यू टॉपिक, जैसे मैं कुछ नया पढ़ाने जा रही हूँ, यू कैन स्टार्ट विद अ रोल प्ले, you can start with some scenario, you can give a story, you can narrate something of your experience in life and you can tell about that, and then you start and then you introduce a topic. State the objectives before starting. Now many times our teachers will go and we'll start with the content, but students should know कि objective जो हम बनाते हैं वो हमारे students के लिए, उनको पता होना चाहिए कि at the end of this class मेरे को क्या क्या करना है, मैं किस चीज, और वो also दिखाते हैं कि इन्हीं ऑब्जेक्टिव पे उनको इवैल्यूएट भी किया जाएगा, ठीक है, सो दैट्स वे दे विल बी एबल टू, सो स्टेटिंग द ऑब्जेक्टिव इज वेरी इंपॉर्टेंट। नेक्स्ट प्लीज। पेसिंग इज वेरी इंपॉर्टेंट। पेसिंग मतलब मूवमेंट ऑफ अ टीचर इन द क्लासरूम। क्लासेस में बच्चे बहुत हैं, पीछे के बच्चे 100 बच्चे हैं, एज अ टीचर आई एम नॉट एबल टू सी देम। क्लास में घूमना, बिकॉज बच्चे बहुत कुछ करते हैं, दे आर गेटिंग बोर्ड, दे मे बी रीडिंग बुक्स, दे मे बी स्लीपिंग, दे मे बी डूइंग मे बी फोन्स नाउडेज, अ बिग डिस्ट्रैक्शन, तो बहुत इंपॉर्टेंट है। और ऑल्सो यू व्हेन यू वॉक, व्हेन यू हैव मूवमेंट पेसिंग, आप बच्चों का आई कांटेक्ट करेंगे, सो दैट इज वेरी इंपॉर्टेंट। अप्रोप्रिएट टेक्निक, देयर इज अ क्लिकर। एक मैं जब क्लास के लिए प्रिपेयर कर रही थी, I found one article जिसमें कि क्लिकर्स के बारे में दिया था। क्लिकर्स वो थे कि उन्होंने एक स्टडी किया, रिसर्च, जिसमें उन्होंने कहा कि देखते हैं कि स्टूडेंट्स का अटेंशन और कंसंट्रेशन देखने के लिए what we should do, so they introduce clickers, और वो जो clickers जो उन्होंने इंट्रोड्यूस किए वो थे questioning technique, so every 15 to 20 minutes they have used, we can do even 10 minutes, some very questioning, the student. And that will, if you ask in between question, that if they are distracted, they will come back to it and they will be focused. Appreciate students when they answer questions. बहुत जरूरी है कि हम appreciate करें। जब आप question करते हैं, बच्चे आंसर देते हैं, हम अच्छा ठीक है बैठ जाओ, और ये भी नहीं बोलते बैठ जाओ, हमें कहना है कि very good answer, or very good that you have taken effort. जब वो गलत आंसर दे तो ये नहीं कहना नहीं बिल्कुल गलत, बैठ जाओ, पढ़ के नहीं आई हो, but we have to say क्या, we appreciate कि आपने एफर्ट तो लिया, आप इतने बोल दे कि इतने 100 बच्चों में उठ के आपने जवाब दिया, लेकिन बेटा इसका आंसर ये है। So this is way we need to talk to our students. Repeat their answers to the class. जब student acknowledgement बोलते हैं इसको, you are acknowledging the student. किसी फर्स्ट रो में बैठे हुए स्टूडेंट ने आपको कोई आंसर दिया, आपने पढ़ाना शुरू कर दिया, जो बच्चे ने आंसर दिया उसको रिपीट करिए ताकि वो पीछे वाले रो के बच्चों को भी सुनाई दे। दैट इज एक्नॉलेजिंग स्टूडेंट्स आंसर। ये सब चीजें बहुत पॉजिटिव होती हैं एंड इट हेल्प्स इन क्लासरूम टीचिंग। मेंटेन आई कांटेक्ट, आई थिंक वी ऑल नो अबाउट इट। नेक्स्ट स्लाइड प्लीज। तो आस्किंग क्वेश्चन इंपॉर्टेंट है, स्टूडेंट हमारे लिए भी नहीं, बट वी हैव टू एनकरेज स्टूडेंट्स आल्सो टू आस्क क्वेश्चन। समटाइम क्या होता है, टीचर्स, मैंने ये भी रिमार्क सुना है, जब बच्चे ज्यादा क्वेश्चन लगते हैं तो स्टूडेंट टीचर्स क्या कहते हैं, ज्यादा स्मार्ट मत बनो, यू आर एक्टिंग वेरी स्मार्ट। दोस टाइप ऑफ रिमार्क्स वी शुड नॉट गिव, हमें इंकरेज करना है। ओके, द मोर स्टूडेंट्स आर आस्किंग क्वेश्चन, दैट मींस आपकी क्लासरूम टीचिंग इफेक्टिव हो रही है, तभी तो बच्चा आपसे पूछ रहा है, ठीक है। एंड इंटरैक्टिव पार्टिसिपेशन, ये सब चीजें हमें करते आ रहे हैं। आई हैव जस्ट रिटन इट। समराइजिंग योर क्लास इज वेरी इंपॉर्टेंट, ये भी कि बस किया और भाग गए। The subheadings, summary हम लिखते हैं, लेकिन how many of us really summarize? Lesson plan में होता है, लेकिन miss out कर देते। Summarization is very important. It has a lasting effect students के ऊपर। Assignment बहुत जरूरी है, आप उनको assignment जरूर दें, आपके lesson plan में भी होना चाहिए। Assignment दीजिए and make sure that you follow up on assignment. आपने दे दिया, आपने bother ही नहीं किया, उसके बाद टाइम ही नहीं रहा, आप उनसे बोलिए ताकि they know कि उनको assignment करना है। फर्दर रीडिंग के लिए दे सकते हैं कि हम नेक्स्ट क्लास में बच्चों ये पढ़ेंगे, पढ़ के आइएगा। दोस थिंग्स आर रियली मैटर्स इन द क्लास। एंड आल्सो क्विज अगर है बच्चों की, they I told you children really like quiz, they really, and I have used it in my teaching and it has been very effective. Constructive feedback. Now this word constructive feedback is very important. We don't say negative feedback. है ना. We give them construct. Construct का मतलब है how they can really build up what they already know. वो feedback हमारे लिए बहुत positive देना बहुत जरूरी है. Those students who are weak, उनके लिए अलग से classes हम लोग कर रहे हैं कि नहीं कर रहे हैं, उनसे पता करो कि वो क्यों disturb हैं, why they are not able to focus. So classroom teaching जो है बहुत ज्यादा responsibility की चीज है हम लोगों के लिए. Be enthusiastic. टीचर को स्माइलिंग फेस होना चाहिए, है ना, so that they can approach, enthusiasm. आपका हमारा enthusiasm देख के they also will be enthusiastic about learning. Senior faculty with long experience, जैसे मेरे जैसे लोग क्या करते हैं कि are we really updating our lesson plans? मैंने बनाया होगा 10 साल पहले एक lesson plan because I am teaching, मेरा specialty psychiatric nursing है, mental health nursing है, so I am teaching the same thing what I taught 10 years पहले अपने students को. That is wrong. So I would urge the senior faculty कि हम लोग भी अपने plans को update करें, with the new things which have emerged. Readiness to change and adapt. ये भी मैं कहूँगी कि as we are getting older, senior faculty again, sometimes it's difficult for us to change ourselves. Even juniors, कहीं और काम किया है, दूसरे कॉलेज में आ गए, कि वो नहीं change कर पाते अपने आप को. But try to, we have to have that learn readiness to change and adapt to new technologies. Next slide, please. So this is, I'm almost at the end of my slides. This was a study which was done by Thompson and Sheckley. They have done this study, I told in the beginning of my slides presentation, I said, and the students rated their teachers. So ये जो point है, 5 point were the top 5 points that the students said that their classroom instruction was really best rated. Those were best rated, जिनके teachers were well organized and highly knowledgeable. Clarified time on task, जिन्होंने उनको पहले से बता दिया कि ये आपका है टाइम, इतने टाइम में आपको ये असाइनमेंट सबमिट करना है, इतने टाइम में आपका ये यूनिट टेस्ट लिया जाएगा, पूरा प्लान आउट जो चॉक आउट था उनके लिए. क्लैरिटी. Encourages cooperative learning. जो cooperative learning, group work, those things they have enjoyed most. Promote active learning and communicates high expectation. As I said earlier, कि students को ये बताना कि उनके high expectations उनके लिए क्या हैं, ऐसे teachers को students ने best rate किया, ऐसे teachers को, ठीक है. So this was a study which was done and I wanted to just share about it. Next slide. So here we are in the conclusion of this class. I know that a lot of things you already know. Sometimes we know everything, but we don't do. Knowing and doing are two different things. We may have knowledge, but are we really practicing? So we need to become like हम अपने students को चाहते हैं कि वो सिर्फ knowledge ना gain करें, लेकिन practice भी अच्छी करें, skill भी develop करें. But what about us as faculty? हमारे पास knowledge है, हमें सब point पता है, आप लोगों को पता हो रहा होगा, शायद बोल भी हो रहे होंगे क्लास में, लेकिन पता है but क्या हम ये कर रहे हैं? What is our practice? So that we need to see with these classes, these sessions which have been organized by UP State Medical Faculty. In conclusion, I would say that classroom teaching plays a very important role in education of nursing students. As I said, पहला है उनका ये. This is the first encounter. जब नया student आता है, पहले classroom में आते हैं. So what we are giving them then, there, that is for them, which will last long for them. And that will help them in their clinical application and clinical learning also. And also it is critical for, to prepare nursing students for successful career in health care scenario as well. And that is the motive of ours, that हमारे students जो है वो आगे चल के, they do something, they become successful in their lives as the nursing professionals. So this is all from my side. Thank you very much once again for your patient learning.
Thank you very much, ma'am. Really, thank you so much. And I'm grateful that you are the part in our webinar. So, हमने मैम की क्लास को सुना and I feel हम लोग अगर क्लास लेना है तो हमें सेल्फ पहले प्रिपेयर करना भी जरूरी है. क्लास तो हम रोज लेते हैं क्या, लेकिन क्या हम वो सब चीजें करते हैं जो हमें करना चाहिए, जो हमारे प्रिंसिपल्स को हमें फॉलो करना चाहिए, क्या हम करते हैं? क्या हम लेसन प्लान बनाते हैं? क्या हम लेसन प्लान लेके जाते हैं? क्या हम एविएट्स कभी बनाते हैं, या हम ऐसे ही जाते हैं? क्या हम बस ब्लैक बोर्ड के ही यूज कर रहे हैं? तो हमें इससे ये पता चलती है कि हमें जब क्लास लेना है तो हमें सेल्फ प्रिपेयर करना जरूरी है। पहले सेल्फ प्रिपेयर कीजिएगा, लेसन प्लान बनाइएगा, एवीएट्स प्लान करिएगा, मिनिमम 2 से 3 एवीएट्स प्लान करिएगा, और उसके बाद आप टॉपिक को, पहले जब आप क्लास लेते हो तो टॉपिक को इंट्रोड्यूस करिएगा, बच्चों को डाउट्स पूछिएगा, उनकी उनकी डाउट्स क्लियर करिएगा, क्वेश्चंस पूछिएगा। और जब हम क्लास लेते हैं तो थोड़ा मूवमेंट भी रहे क्लास में, और सब बच्चों पे हमारी नजर रहे, और जब टॉपिक खत्म होने को आता है तो उसको हम अच्छे से समराइज करें, कंक्लूड करें, कहाँ से क्या रेफरेंस लिया है बताएं, असाइनमेंट्स दें, और बाद में हम क्लास को, अगले क्लास क्या पढ़ाने जा रहे हैं। तो ये सब चीजें अगर हम, जो पूरे चीजें जो है प्रिंसिपल्स ऑफ टीचिंग में आता है, अगर हम हमारी टीचिंग में इसको यूज करते हैं, प्रैक्टिस करते हैं, तो हमारी टीचिंग जो है और भी इफेक्टिव रहेगा, और हमारी एजुकेशन में और भी चेंजेस एंड अच्छे आउटपुट्स ला सकते हैं। सो really ma'am, we have got lots of information, and it is very useful from your session ma'am. Next, I request Dr. Sheila Tiwari ma'am to kindly take her session. Sheila ma'am, over to you ma'am.
Thank you, Dr. Neetu. Am I audible?
Yes ma'am.
Okay, respected principal ma'ams who are here, senior faculty members, HODs, faculty members, a very good afternoon to all of you. This time I would like to thank Dr. Alok Kumar, Principal Secretary, UP State Medical Faculty, and Dr. Neetu, Consultant to UP State Medical Faculty, for providing me this opportunity to share the platform with the eminent personalities in nursing. So we were hearing Dr. Priscilla ma'am, who was explaining in detail about the classroom teaching. So since we are there in the nursing profession, we all know along with classroom teaching, lab demonstration is also very, very important in our profession. So lab demonstrations are equally important, as nursing is a skilled profession. So many of the times, even if we don't know the principles of demonstration, either we may not follow it, or we may not find adequate time. So this particular webinar is organized along with other topics just to brush up our knowledge and to improve our skills in demonstration. Ma'am, can you share the slide, or shall I?
We'll share. We'll share,
Yes,
ma'am.
yes, ma'am. Next slide, please, ma'am. So today's session will be, I'll be taking under the following headings: demonstration as teaching method, phases of procedures, the common errors in demonstration, key points to remember in demonstration, ethics we have to follow in demonstration, and finally the recording and documentation. Next slide, please. So what is demonstration? We all know, we all are teachers, but I'll just brush up your knowledge. Demonstration is defined as visualized explanation of facts, concepts, and procedures. It's a method of presentation of skills which shows how a particular procedure is performed in the clinical setting. That is, before the students are going in the clinical setting, we are making them to skill practice in the demonstration lab or skill lab before they are going to do the actual clinical procedures. To prepare the nursing students to practice the appropriate fundamental skills to meet the needs of patient in healthcare settings. Not only the procedures, many a times the students are not very competent to identify the patient's needs or we want to help them how to identify a particular patient's needs, and accordingly we will develop the nursing care. So this also can be simultaneously practiced in the nursing skill lab. Next slide, please, ma'am. So in a demonstration, other than classroom teaching, we all know the students are listening to us. The students' participation is very important. And ma'am had already discussed in very detail what are the principles of teaching. We are not leaving all these principles. ये सब principles हम लोग मन में रखते हुए हम लोग demonstration के लिए जाते हैं. So the principle of learning by the use of all senses. Here हम लोग जो है procedure करते हैं. The students are seeing you, watching you and observing you. तो सब चीज और ज्यादा उनके जो है दिमाग में बैठ जाते हैं. So any learning when we do by observation, so that makes a sense in the learners. हम लोगों को पता है घर में जो छोटे बच्चे हैं, बड़े जो करते हैं वो सेम रिपीट करते हैं. So here the same principle. हम लोग जो करते हैं वो सेम चीज रिपीट करते हैं. अगर हम लोगों ने गलती किया वो गलती भी बच्चे रिपीट करेंगे. So the demonstrator or the teacher who is demonstrating should be very very careful while demonstrating the procedure, क्योंकि आपकी जो गलती है वो स्टूडेंट भी रिपीट करेंगे. पर कभी कभी हम जो बोल देते हैं वो शायद ये लोग भूल जाता है, बट समटाइम्स जो देखते हैं through the senses, that is by seeing the things, they will exactly copy the same thing. So whenever we are doing a lab demonstration, see that so many students are watching you and your demonstration should be perfect. So it's a learning by observation. Next slide, please. So before starting any procedure, so just for your knowledge, and it's very easy for us to remember. We don't even have to like think how I should go about, because this is a common problem कि procedure करने में बहुत hesitation होता है. Many of the especially the junior faculty कि it's not their fault, it's not your fault, I'm telling. Means maybe we all are not skilled to do that, और maybe हमारा उतनी practice नहीं हुआ होगा वो procedure करने के लिए. तो हम लोगों को थोड़ा हेसिटेशन होता है प्रोसीजर, बट क्लासरूम टीचिंग वी इमीडिएटली डू, बट व्हेन कम टू द डेमोन्स्ट्रेशन वी बिट गो बैकवर्ड कि प्रोसीजर मैम बाद में करेंगे या फिर किसी और से कराएंगे. सो दिस इज नॉट वेरी difficult to do the procedure if we are equipped or practiced nicely. So for the easy way, we have to remember 4 things in procedure. The procedure starts with P. And the procedure, there are 4 P's, which if you are keeping in mind and then go step by step, then it's very easy for us. So what are the 4 P's? First P is preparation of self. The second P is preparation of patient. The third P is the procedure itself. And the 4th P is post procedure. So when we start with the first P, that is the preparation of self, I'll be discussing in detail each P, what we are supposed to do the preparation in each of the P's. Okay, so the first preparation is preparation of self. So before going to do any of the procedure, so if we are completing with all these P's, and I assure you the procedure and the demonstrations will be very fun and it will be very nice. We are doing such a good procedure and you feel that satisfaction. Okay, so I'll be discussing it one by one with you. Next slide, please, ma'am. So before going to the P, let me tell you something which is not only the principals or HOD's duty, it is each one of us. It's every one of us duty to see the physical setup of the lab. Then what is there in the physical setup of the lab? We have to see is whether we have adequate space. Like, maybe sometimes what happens is we have 60 students or 100 students. So we have to see as per the INC criteria, norms, we have the adequate space which is prescribed. The second thing is good light and ventilation. Sometimes what happens is when we are doing most of the times we can see the procedure demonstrations are scheduled in the afternoon hours. Children feel sleepy and may not be that much interested. So, like good light is very much enough, and there should be cross ventilation so that we also feel like good. हमें भी अच्छा लगता है, अच्छा light और ventilation है. See that it is done like how madam had told. See that the windows are open, curtains are drawn. ये सब छोटे-छोटे चीजें हैं, हम लोग कभी ध्यान नहीं रखते हैं. But this makes lot of difference when we are teaching. The third is adequate racks, cupboards and equipments. जैसे कि हमारे पास बहुत सारी चीजें, किडनी ट्रेज, आर्टरी फूड्स, सो मेनी थिंग्स आर देयर, इधर उधर नहीं डालने से अच्छा है कि सब चीज के लिए रैक्स होना चाहिए, कबर्ड्स, एंड द इक्विपमेंट शुड बी डिवाइडेड एज पर द लाइक मे बी द स्टील आइटम्स, दैट इज अप टू यू हाउ यू वांट टू डिवाइड, लाइक द फर्स्ट कबर्ड what you want to keep, second rack what you want to keep. So this should be adequately equipped with the racks, cupboards to keep and store the things. Then adequate mannequins. You should have adequate mannequins. Number of mannequins should be proportional to the number of students. If you have a lot of students, if you have only 1 or 2 mannequins, it is very difficult to do the demonstrations. So see that we are having adequate mannequins. Then in the lab, we should have boards and erasers. Sometimes we want to draw something and show, so there should be a blackboard or a whiteboard should be there in every labs, and the erasers. The important thing is hand washing facility, because we know before and after every procedure we have to show them hand washing, and it is a must. So we have to see that all the labs are equipped with hand washing facilities. Next slide, please. Next slide, please, ma'am. So coming to the piece, the previous slide, yeah. Now, coming to the piece, the first is preparation of self. Now, how will you prepare yourself? The first and the foremost thing is we should be very, very thorough with the skill lab hours of each unit, like whether it is a foundation of nursing or maybe it is a child health nursing. What are the hours, skill lab hours, which is prescribed in the syllabus? Okay, maybe your HOD may be allotting, or maybe your principal must be allotting, but still you are supposed to know in which unit it is coming and how many hours are allotted for each procedure. This is why this is important, is because you have to plan as per the number of students, the demonstration. So in my coming slides, I'll be discussing about that. The number of students, we cannot take the entire batch in the laboratory at a time. So you have to see the number of hours prescribed plus the number of students in your batch and how you can divide the students for your procedure. Okay, so the next thing is, like, even the return demonstration hours are also included in this. So you have to equally plan for your demonstration as well as the students return demonstration. तो दोनों को combine करके आप अपनी skill lab hours plan करनी है class आप शुरू करने से पहले. The second thing is demonstration should follow immediately after theory classes. इसका मतलब ये है कि हम लोग कोई भी demonstration का जो theory ले लिया है और हम लोग procedure कभी-कभी postpone कर लेते हैं. Right? For example, we have taken the theory classes of bed making for the first year. There are a lot of, I think around 2 or 3 hours, we may be talking about different types of bed and so all these things. And the next thing what we think is like, let me finish the theory class सबका और उसके बाद में last में पूरा demonstration दिखाता है. But what will happen? You all know कि after you finished with the theory class, they might be forgetting what you have told the principals and everything, and that efficiency will not be there. So it is better always. It's good to plan the procedure immediately after your theory class. May not be the same day. उसी दिन हम लोग हो सकता है हमें time नहीं मिलेगा. हम next day कर सकते हैं. But you finish the theory and procedure and then go to the next topic. For example, again, one thing I'll tell you, sponge bath. Sponge bath, we took the theory. So the same teacher is going to take maybe the back care also, or maybe the care of pressure points also. So we may think, हम दोनों का theory ले लेते हैं, एक साथ demonstration दिखाते हैं. Many of us do this. That's wrong. Okay. So we should not do this. We finish with the sponge bath. Next, go and take the theory class of the care of pressure points, and then you can show the care of pressure points procedure. So that would be effective demonstration. And the third thing is well-structured lesson plan. Then the checklist. And these two I'll be discussing in the next slide. And next, the entry behavior of learner and determine the prerequisites, like whether your previous knowledge of the group, like maybe you are doing for the first year knowledge level is different. You have to explain each and every small things to them, because sometimes what we tend to do, the teachers who are teaching for the senior batches or maybe in the MSc classes and all, they may go in that particular level. So we have to see the level of knowledge of each student. Your first year BSc student are having a different knowledge. Your second year MSc is having a different knowledge. Post basic is having a different knowledge. So हमको ये पता होना चाहिए जिसके लिए हम demonstration करने जा रहे हैं उन बच्चों का basic level of knowledge क्या है. So accordingly you have to explain the things. Next slide, please. Now, the thing which I told in my previous slide, well-structured lesson plan, even ma'am has discussed about this. Even हम ये demonstration के लिए हम सोचेंगे कि क्यों lesson plan चाहिए. And most of the times, like we feel, many of the seniors feel like when we say, I know all the principals must be telling, make your lesson plans and show us, get the correction. I'm very sure about that. So what happens is it becomes like teachers take it like a burden. कि इतनी सारी हम लेसन प्लान कैसे बनाएंगे, हमारे पास इतना टाइम नहीं है. But let's see, like, lesson plan is a basic structure, or it is the framework of our teaching, irrespective of it's a classroom teaching or it is a lab demonstration. Because any person, any profession who is going without a tool, there is no use of doing that particular job. Same with us also. For a teacher, lesson plan is the most important thing. So when you're making a lesson plan, you have, that each and every small things, minute things we are mentioning in that. So if you frame the objectives clearly, and I think that is very successful for a successful teaching as well as for a demonstration. Once you frame the objectives nicely, then everything will become very easy for you. And you know what you're going to do. And you have framed yourself very nicely. You made the blueprint and now you have to only deliver. So you will not repeat the things. You will not, over stress on something where you are supposed to give importance. Usi same way आप focus करेंगे. And the second thing about lesson plan is you can plan your timing. Like कभी-कभी क्या हो जाता है, हम class में भी हो, demonstration lab में भी हो, we roam around, we beat around the bush sometimes, like कि बहुत सारी दूसरी चीज में हम डाइवर्ट हो जाएंगे. तो एक क्लास में जो खत्म होना चाहिए वो एक क्लास में खत्म नहीं होएगा. It may go up to 2 hours, 3 hours. So that is why the lesson plan and unit planning, all these things are important. हमारा टाइम जो है accurately हम प्लान कर सकते हैं. Especially we all know कि अभी जो semester system start हुआ है, we don't have time. The students don't have time. We don't have time. It is very, small slot which we have got, and we have to plan everything in a proper way. So this is very important. And the third thing about the lesson planning, it's motivate the students also. Like, when we are outlining a thing, the student also know the teacher is well prepared. आजकल के बच्चे बहुत smart है. If you all agree with me, कि they know already, many of the times we feel ये बच्चे बैठे हुए हैं हमको test करने के लिए. Because पहले इधर पढ़ के आ जाता है, or they know everything and they will try to question us, or maybe it may not be intentionally sometimes. So if they know the teacher is prepared very nicely, it will motivate the students also. Okay. So the next is the instructor must explain the precise action. Now in your objective, you are mentioning like, to demonstrate the procedure, but the things when you are coming down, you may not be writing the objectives about each and every step, but you will be writing the exact action, what you are going to do in the procedure. And also when you are explaining the things, everything you should explain with the rationale. You should never say like, ki aise hi karna hai. See, many of the times, things must have become like, obsoleted or maybe outdated. So it is not necessary that textbook में जो बोला गया है वही है. अभी चीजें जो चेंज होती रहते हैं, तो आप उसके लिए अपडेट हमेशा होना चाहिए. The person whoever is taking class should be updated with the latest part of the things, and you should be able to explain the rationale of the things, like why you are doing this particular thing. It's not necessary कि they will understand, कि assume करेंगे कि ये इसी के लिए किया है. So you have to explain why that particular procedure is done or step is done. Instructor should also explain the end result. कि final outcome हमारा क्या होने वाला है at the end of this procedure. That should be well explained in the lesson plan. Next slide, please. The second part about self-preparation is checklist. So again, we all make checklist. Now the checklist should be standardized. Okay, the checklist, ready-made checklists are available. Sometimes the teachers prefer to make their own checklist. Either way, the checklist should be standardized and it should follow the exactly same step of the procedure. Like आप checklist कुछ दिया है बच्चों को, पर उन लोग स्टेप कुछ, आप कुछ स्टेप अलग कर रहे हैं, तो दोनों में मैचिंग नहीं होते. Again, this creates a confusion for the students. So for this, you have to be very careful that the procedure and the sequence should in the checklist and your procedure should be same. Checklist should be available for all the students. आप प्रोसीजर के बाद आप ये नहीं बोल सकते सब लोग अपने अपने पास चेकलिस्ट जेरोक्स करके रख देना या कॉपी करके. You have to give the checklist to the students before the procedure, and it should explain the checklist to the students. Now, the next is, after giving the checklist, you should see that every procedure should have the checklist maintained even in the labs also. Suppose you may not be the person who is taking the written demonstration. Maybe you are assigning another teacher or your colleague or anyone to see the written demonstration. So she may not be aware what you have done, but the same checklist is kept in the labs so that they also can follow the same thing. Next slide, please. The next in preparation of self is collection of articles. So we see in the procedure which are the articles required. The entire articles should be collected before the procedure. Not that the students are coming in look khade rehne ke baad, sometimes we might have forgot, oh, I did not take the kidney tray. It normally happens. I'm just talking the things which generally happens in the labs. So in between hum gaye, fir leke aaye hain. So it's better you all collect the articles beforehand itself and see that it is arranged systematically. The article should be there which you are going to use first. कि for example kidney tray आप पहले नहीं रखना चाहिए क्योंकि kidney tray हम last में use करने वाले हैं, और maybe paper bag will be used last. So the articles which you are using in sequence should be kept in the way as it is. Like for example, bed making, the top sheet, bottom sheet, Macintosh, pillow cover. So it should be arranged in such a way that it should be in sequence. And don't tell students to assume about a particular article. Like, sometimes the article may not be available in the lab, or it may not be available. And what happens is when we are going to do the procedure only, हमें पता चलता है ये particular article नहीं है. तो हम ये बताते हैं बच्चों, this article also should be there, पर आप assume कर लेना, या फिर आपको हम बाद में दिखाते हैं, ये हम बताते हैं, which is very, very wrong. The same thing again children will do. जब उन लोग procedure करते हैं, article missing है, तो they will also say the same thing, or they might not have seen that article. So we cannot do like that. So we see that the article is available, and then we will plan for the procedure. And before telling about all the articles, or before doing the entire procedure, we see that each and every article is in a working condition. कभी कभी बीपी apparatus का mercury ऊपर नहीं जाता है, steth is not working, we started with the BP. So this thing should not be there. So see that all the articles are in working condition. And then we should rehearse the demo before the original demonstration. एक बार या दो बार हमारे colleagues के सामने या फिर हमारे senior के सामने एक बार ये हम लोग demonstrate करके दिखाएंगे, ताकि any points if you are missing or anything which has to be added or reduced can be practiced before showing to the students. Next slide, please. Now the second part is preparation of patient. So the second P is preparation of patient. Now, preparation of patient, the first and foremost thing before doing a procedure, we always say we should check the patient file. Anything specific doctor's order is there, or any contraindication is there. So check the patient file and identify the patient. See that now even if we are doing in the demonstration, maybe you are thinking ये तो हम लोग clinical में करते हैं. तो clinical में करने से पहले exactly the same thing we are doing in the skill lab. So we are doing your mannequins. So mannequin should be given a name. The patient file should be made in the lab for that particular mannequin with the proper name, age, and make a situation. And then you should show it to the students. You demonstrate it to the student that the patient file is there, and you identify the patient by bed number and name. Sometimes the same name will be there for different patients. So you have to specify that, especially to the first year students. Otherwise, they can make a error. Then the third is check doctor's order for anything specific is there. Collect all articles near the patient. The patient articles should be arranged near the bedside locker before doing the procedure. And the next thing is you should provide privacy. and that is again important. We say provide privacy, but we don't show it to the students how we are going to provide privacy. So in front of them only you should draw the curtains, or you should keep the privacy, anything where there is, you can provide or keep. If it is in a separate room, there is no problem, but in the demonstration room, the mannequins, other mannequins is there, and you can see it is open. So always show the students that this is the way to provide a privacy by screening the patient. Then explain procedure to the patient and gain confidence. Same things. We say you should explain the procedure to the patient, पर आपको करके दिखाना है बच्चों को कि कैसे आप explain करेंगे कि for example Mr. So and so कि आपको हम ये आप कब से एडमिट है. नॉर्मल कम्युनिकेशन शुड बी मेंटेन विद द पेशेंट कि आप कैसे हैं, आज हम आपके ऊपर ये प्रोसीजर करने जा रहे हैं, सो दैट स्टूडेंट ऑल्सो विल डेवलप दैट हैबिट when they are doing that. Patient से communication वो करे. Normally this has become so much reduced nowadays. Even the many of the doctors, many of the senior people are complaining that बच्चे लोग बात नहीं करते हैं patient से. So the communication has been reduced. So we have to inculcate them in the students from the first year onwards. We have to properly communicate to the patient to gain the confidence. Next slide, please. Then comes the third P, that is actual procedure. So we have prepared ourselves, we have prepared the patient, we have collected all the articles, and next the procedure. Now we have to make small groups of the entire class. That's why in the planning phase itself, you have to plan कि हमारा ग्रुप कितना होने वाला है. फॉर एग्जाम्पल 60 स्टूडेंट्स आर देयर, आप 10 ग्रुप में कर रहे या 6 ग्रुप में कर रहे. सो दिस मेनी आवर्स यू हैव टू कैलकुलेट in the starting itself. So the group should be only 6 to 10 and there should be in a semicircle manner. Why? Because all the students should be able to see. Now some things we have to keep in mind before starting this कि जैसे कि मैं previously मैम ने classroom teaching में बताया कि सब बच्चे एक जैसे नहीं है. किसी का grasping capacity ज्यादा है, किसी का कम है, और maybe some are not very attentive. It all depends on the teacher how we are going to deliver our demonstration, कितना interesting हम बना सकते हैं. So it has to be an interactive session. The procedure with rationally as per the checklist. So you have to go order as per the checklist. You should be thorough with that. You cannot see the checklist in between. Next step मेरा क्या है, इसलिए हम लोग पहले से practice करके रख देते हैं. तो checklist में जितनी procedure steps बताया है, along with the reason or rationale we have to explain. And the demonstration should be completed in a normal speed, not very fast or not very slow. So smoothly, original patient के ऊपर कैसे कर रहे, same exactly in the same way you have to demonstrate the procedure. Avoid negative example and variation in technique. Like first time when we are going to do the demonstration, हम positive side ही बताना, कि हम लोग कभी ऐसे करने से ऐसे होगा, ऐसे करने से ऐसे नहीं होगा, ये नहीं बोलना. You should just do the procedure. Do's and don'ts of the procedure पहले ही नहीं बोलना है, because that will create a negative impact. Or maybe variation from the normal technique. Always you can improvise the things. You can teach them to improvise the things or update, but not a variation from the technique which is against the total procedure. That should not be told to the students. It should stimulate the clinical setting as much as possible. That's why I told you, show us almost real only. Like you can give the situation, Mr. Y, so and so admitted in the male medicine ward with the complaints of fever and diagnosed as a case of so and so. And he needs to check the temperature every 30 minutes or every 1 hour. You can say the situation and then you can say, now I'll be demonstrating the procedure of temperature for Mr. So and so. So this will make almost a real situation so that the students also will learn the same thing. Next slide, please. Now, once your procedure is over with all the checklists, post procedure is also equally important like your procedure. Why? Because what happens once we finish the procedure, हम लोग ये चीजें छोड़ देते हैं. Like आप लोगों को सबको समझ में आया तो हम लोग छोड़ देते हैं वहां पर. But we forget main important things are there after the procedure, like replacing of articles. Many times this is a common complaint, or we can see especially from the lab in charges कि मैडम की articles करने के बाद छोड़ दिया है, कि replacement नहीं हुआ है. This is a wrong thing from our part. आपको ये लगेगा कि मैं छोटे छोटे चीज में क्यों focus कर रहा है. These small things are very very important in our profession. We have to be very much practical. कि theory is very easy to talk, but practical things we should keep in mind, like replacing of articles. How, like, it's not that you have used all the articles and just kept on the side. No, the things which has to be washed should be washed, dried, and kept inside the cupboards. The things which has to go for reuse, it has to go for washing. Linen can be sent to the laundry. So ये बोलना है बच्चों को where your articles are going for replacement. So इससे क्या होता है, बच्चों को भी समझ में आएगा कि this particular article enamel where has to be treated or disinfected in this way, because you are showing them. Linen you are putting in the laundry and you are showing them like this is going for the dhobi or for washing. तो ये आपको करके दिखाना है. The next is, once you go replace the articles, wash your hand. Again washing, hand washing has to be shown to the student कि procedure के बाद आप hand washing कर रहे हैं. Then you come and document the procedure. Now record the procedure. We always say use this word, record the procedure. पर आपको again documentation करके दिखाना है बच्चों को how it is supposed to be documenting. आपने क्या observation किया है while doing the procedures, anything which is abnormal जो report करनी है, ये सब चीजें आपको documentation में करके आपका sign करनी है with the date. So that this has to be shown to the students. After that, you can collect the feedback and clarify the doubts of the students. You can ask each student, and after that, you can also provide immediate supervision. Sometimes we immediately make the one of the student to do the written demonstration. I remember when we all were students, like the midterm corner never used to come in the first year. Midterm corner का जो angle है कभी आते नहीं थे. So many times they our teachers might have made us to do that. So repeatedly when they are doing only, the procedure will be like, they will learn the procedure. And once that is over, you can summarize the session. Now, this was our fourth P. So all the 4 Ps we discussed. Now, there are certain common errors we do in the demonstration. The first thing is, apparatus may not be ready for the use, or any of the articles, sometimes it may not be ready for the use, or maybe sometimes we start the oxygen procedure and the oxygen may not be available in the cylinder, it is empty, or maybe the water bottle is not working. So all this has to be checked before we are actually doing the procedure so that no error will happen. Deficiency of articles, of course, I have discussed with you. It should not be there. See that all the articles are available before doing the procedure. Now, you don't assume that your HOD or, maybe the lab in charge know about that. The person who is demonstrating, please report the things which are deficient, because the person in charge may not be aware what is finished and what article is not there. So you have to report that. Not adherence to the checklist. Checklist exactly follow karni hai. I have already discussed with you. Inadequate preparation from the teacher part. Sometimes, the procedure is like you have to do jaldi karna hai. मैंने adequately prepare नहीं किया. Somehow I just want to finish it off. ये नहीं होना चाहिए. We have to adequately prepare because it will create a bad impression. तो bad impression का भी नहीं. अगर आप मुझे पूछेंगे कि how I am doing the procedure, मैं अपनी teacher जैसे जो सिखाए वही आज भी follow करती हूँ. उनकी जो वे है वो फॉलो करती हूँ. तो आपका जो स्टूडेंट्स है प्रोसीजर जो करेंगे एग्जैक्टली आपने जो किया है वो ही करेंगे. तो यू कैनॉट शो एनी ऑफ द डेफिशिएंसी थिंग्स और इनएडिक्वेट प्रिपरेशन टू देम, क्योंकि सो मेनी स्टूडेंट्स, आई नो मेनी ऑफ माय स्टूडेंट्स आर आल्सो वाचिंग. So we cannot say at the end of the day your students are telling मैम आपसे हमने बहुत कुछ सीखा, आपके जैसे हम कर रहे. This gives a lot of happiness to us as a teacher. So see that you are adequately prepared. And the time limit, we should have go as per the timing, but you plan your timing, because in a hurry you cannot do. आप अपना timing plan करके as per that you do. Then poor documentation. I told you documentation is very important. बच्चों को ये नहीं पता होता है मुझे क्या record करनी है, documentation कैसे करनी है, जब तक आप नहीं करेंगे. तो आप लोग many times I have faced this problem कि टीचर्स बोलते हैं आप फॉलो कर लो, ऐसे कर देना. बच्चे आके पूछते हैं एग्जैक्टली क्या लिखना है नर्सेस नोट्स में. सो दे आर नॉट अवेयर, सो यू हैव टू टीच दैट. poor feedback system. We are not taking a feedback कि बच्चों का की समझ में आ गया कि नहीं. Sometimes क्या होता है, कई बच्चे doubts पूछ लेते हैं, जैसे मैम ने बोला है कि हमको लगता है ये बच्चे हमको check कर रहे हैं. So sometimes our ego is hurt. It happens many times. So that should not happen. We ask each and every students, maybe 2 times we have to do the demonstration, maybe 3 times, but we have to do it and we have to clarify their doubts. And no sufficient for written demonstration. Yes, this is a very important issue. Written demonstration हम लोग चलो हो गया है, demonstration बाद में plan करेंगे. But when you are planning your written demonstration to the end of the year, when you are having time, meanwhile the children will forget what you have taught or what you have demonstrated. So always written demonstration should be planned immediately after the original demonstration. Next slide, please. Now, what are the key points you have to remember? I'll just repeat, which I have already explained. Provide actual clinical situation to the students, which help them to analyze critically. जैसे कि मैंने बोला है कि Mr. So-and-so give the name to the mannequin, so-and-so admitted with the so-and-so complaints, and he needs. You ask the students कि आप कैसे इनकी priority needs क्या-क्या है बच्चों को खुद. So you make the situation like that, so that the students, you are promoting the students or you are motivating the students to think and analyze what is needed. So accordingly, then you can say this patient require this care or this particular procedure can be demonstrated in this patient. Each student should be given opportunity to practice. See that every student, sometimes the student may be shy, they may not come forward, but you can make it very much interesting. Allow the students to practice the skill in small groups in various roles, such as practicing, observing, giving feedback, and simulating the role of the patient. जैसे कि आपको हर बच्चों का demonstration कभी देखने को time नहीं मिला, पर आपको पता है group में at least 5-6 students होगा आपका बहुत अच्छा आपके जैसे demonstration करने वाला. तो उनको identify करके आप उनको group बना दीजिए. जैसे 10 की group, maybe 5 or 6 groups you can make. This we used to do, and I agree, all my seniors will agree to this. तो हम लोग group बनाते हैं और जो बच्चे अच्छे करते हैं उनको हम in charges बना दिया है ये, और she will or he will make them to do like एक का practicing देखेंगे. Already उनके पास checklist है. They all will check and they will give feedback, and somebody can be a patient also. Like हमें occupied bed करनी है. Instead of keeping a mannequin, you can make one of the students to lie down, provided the student give you the consent. So इसमें से क्या है बच्चों को अच्छे से interest हो जाएंगे. If once they become the patient, I know all the students are very much interested. Like मुझे patient बनाओ, मुझे patient बनाओ. They want to lie down, for some time. So they all are very much ready to become the patient. So like this ways you can create interest in the students. Next slide, please. Now, we all are professional people. Certain ethics which nowadays, which we are not finding it very much followed. And I know the seniors are always inculcating in you, but let's follow all these things, which we all know. I'm just brushing up. Professional behavior is always expected in the skill lab by all the users, irrespective of the teacher or the student or any of the people who are volunteers. You have to inculcate the professional behavior in the students or by the users of all the skill lab, like how all the skill lab users, including the students, faculty, or the standardized patients, are expected to be punctual for the learning sessions. Like your timing should be accurate, your in timing should be accurate, your out timing should be accurate. Foods and drinks are not permitted in the lab. There is a reason for this, because once the food and drinks, it may be falling on the bed, or it may, it will not look tidy, neat and tidy. And, the mannequins are there, the costly mannequins articles are there in the lab, which all will get spoiled. That's why we don't allow food and drinks. Sometimes I have seen, like, teachers will have a nice time while the students are having, they may eat samosa, chai and all, I know, but don't make it as entertaining session because it doesn't look like a professional behavior. So we can always do it outside the lab. Mannequins should be handled with care, with proper dress, and maintain privacy. Why we say like this should be, mannequins should be handled properly. The first important thing, mannequins are costly. We all know that. The second thing, we are considering him or her like a normal patient. The proper dress should be given, and privacy should be maintained, like the female mannequins, male mannequins, all this privacy should be maintained, and this should be told to the students also. Sometimes the students mishandle it in a very bad way. So it is the duty of our teachers to inculcate this behavior in the students. Next slide, please. And about the faculty, they should wear aprons. This we all know. While wearing aprons, we cannot let our hair down. So the pinning of hair should be done. The ornaments should be removed. As we know, we are following the principle of microbiology. We have to remove the ornaments from our hand, and the nails to be kept short, because we say to the students, and many of the times we don't follow. The students, we do checking, but we don't follow this. And I'm very sorry to say, majority of our faculty do this mistake. And this has to be, when we are talking, we also should follow the same thing. Bed should not be used for sitting instead of chair. Like sometimes you can see, the demonstrations go on for a long time, and aadhe bachche bed mein baith jate hain. So, they are too much tired. That is, again, should not be allowed. The bed's already mannequins are there. It is considered to be a clinical same situations. They can use the chair instead of sitting on the bed. Next slide, please. The skill lab users should follow universal safety precautions against infectious disease while participating in clinical activities. Saying that clinical practice should be followed in the skill lab also, following all biomedical waste management and universal safety precautions, and everything should be practiced same like in the clinical areas. It is expected that all faculty should have a working knowledge of the simulators, task trainers, or other equipment prior to the use. So, the many of the companies who provide the mannequins, along with that, they come and give the training. See that all the teachers are attending the sessions, and you should know, nowadays we know that it is not that old mannequins which are coming, multitask mannequins are coming. So inadequate knowledge can lead to the equipment failure or maybe fault. So it is better to attend all the training of those mannequin handling by all the teachers, and see that you are equipped with adequate knowledge. Training sessions may be provided as needed and should be arranged through the lab coordinator. If you all don't know how to handle it, please tell to the lab in charges or HOD so that they can provide you with the training sessions. Next slide, please. The students, when they are doing the practice, see that they are not left alone. See that one of the instructors should be always accompanying them. Or, because why the children bahut curious, they will, open the mouth, they will do some screws, they will remove. They are very much curious about all these things. So see that somebody is accompanying, and, under the supervision only, they will be doing the procedure. All the articles should be replaced in the utility room and maintain records. Now, once we are finishing all the procedures, see that the records are maintained by the teacher who is using the lab. Many a times, the teacher who used leave the lab and somebody else has to record the things. Now, which are the records you are supposed to maintain in the lab? I'm not talking about the documentation. Documentation you will be using for the patient post-procedure. The records in the lab also has to be maintained. Next slide, please. Next slide, please, ma'am. Now, the records, we all are maintaining so many records like, lab utilization register, in and out registers, issue registers, all of you may be like, but what happens is at the same time, if you're recording this on the same day, you will not have any further issues during an inspection, or, you may find it difficult. It mismatches sometimes. So this should not happen. On a daily basis, you all can maintain the utilization registers, in and out registers, issue register if you are issuing to other labs or some students, some articles. Stock and inventory register should be there in your lab, plus one lab timetable I'm mentioning here. This is for the convenience of the in charges or maybe the HODs, so that they can also plan the lab for a week's time and see that adequate equipments are there. Lab timetable, we normally put it up in the notice board of the lab. Next slide, please. You can see a sample here, which I have made. This is a weekly one. You can make even monthly timetable, depends upon, when you have lot of courses like, you have A&M, GNM, BSc, it is very difficult to manage all these batches, practical schedules. So it's better to have a timetable in the labs so that everyone can follow as per that and prepare the lab for the same. So this is a weekly one. Next slide, please. So coming to the conclusion part, when we are doing a demonstration, when we say it's a good demonstration, this should be planned and rehearsed. हमारा planning अच्छा होना चाहिए, एक बार rehearse करना चाहिए. Whatever, we may be very much seniors, we may be like how madam told, हम लोग काफी साल से पढ़ा रहे होंगे, पर हमेशा एक बार rehearse करना सही है. We cannot be very much confident. We have to change with the latest things. It should be seen by the whole class. Means everyone should be able to see the demonstration. The lighting arrangement should be good. The statement of purpose should be very clear what we are expecting. Make sure that each and every student is participating in the demonstration. Try to demonstrate the procedures near real, almost same to the clinical situation which I have explained to you. And at the last, we should summarize the topic and ask each and every student all the points are clear. Okay, so this should be an ideal demonstration. I hope you all understood and you will be following this. So you can always have your own inputs also. And I think the session you might have understood. Any doubts you can clear later on. Thank you so much for listening to me.
Thank you so much, ma'am, for sharing your points with us, ma'am, and making things more clear. So that we can practice it when we demonstrate the procedures in the lab. Thank you so much, ma'am. And I would also like to say that if anybody has any queries or any questions, you can drop into the message box. Later, we'll find out to answer those questions. And yes, so procedure demonstration को effectively lab में demonstrate करने के लिए हमें ये teaching principles, इस सब टीचिंग प्रिंसिपल्स को ध्यान में रखते हुए जैसे कि सेल्फ प्रिपरेशन में जैसे कि मैम ने भी कहा, नेल्स कट शॉर्ट रखना, हेयर पिन अप करना, हाथों के ऑर्नामेंट्स को निकालना, जैसे रिंग्स पहन के, जैसे कुछ लोग क्या करते हैं, रिंग्स पहन लेते हैं, चूड़ी बहुत कुछ पहन लेके प्रोसीजर करना, ये सब चीजें ना करते हुए हम जो सही प्रिंसिपल्स है उसको फॉलो करके लैब में डेमोन्स्ट्रेट करें. आर्टिकल्स रेडी रखना जो कि वर्किंग कंडीशन में हो, चेकलिस्ट रेडी रखना, चेकलिस्ट खुद भी पहले पढ़ ले, स्टूडेंट्स को भी पहले समझा दे, और जब प्रोसीजर आप डेमोन्स्ट्रेट करते हैं तो चेकलिस्ट के इस्तेमाल करते हुए करें ताकि आपकी कोई भी स्टेप्स मिस आउट ना हो. उससे आपका जो प्रोसीजर टीचिंग है और डेमोन्स्ट्रेशन है वो और भी इफेक्टिव रहेगा. एंड जब प्रोसीजर हम दिखा देते हैं, प्रोसीजर करने के बाद पोस्ट प्रोसीजर हमें क्या करना चाहिए, जो वो भी बहुत इम्पोर्टेंट है. मोस्टली हम क्या करते हैं, प्रोसीजर कर देते हैं और उसके बाद या तो स्टूडेंट्स को बोल दिया आप रिप्लेस कर देना. सो ऐसा ना करके हम प्रोसीजर्स को पूरा स्टार्टिंग से लेके एंड तक के आर्टिकल्स के रिप्लेसमेंट तक के हम बच्चों को दिखाएं, समझाएं, ताकि और भी क्लैरिटी रहे कि चीजों को हम कैसे अरेंज करना है प्रोसीजर करने के लिए, और प्रोसीजर करके हम कैसे उसको आर्टिकल्स को रिप्लेस करना है सही तरीके से, उसको भी बताना है. एंड उसके बाद प्रोसीजर्स तो कर लिए, उसके बाद जो बहुत इम्पोर्टेंट है वो है कि डॉक्यूमेंटेशन. जो स्टूडेंट्स को हम डॉक्यूमेंटेशन के बारे में बताएंगे. सो let us all practice this all point to make our demonstration more effective, and let us start practicing daily, in our regular lab demonstrations. So going next to the next session, I would like to request Professor S. Balamani ma'am to present her session. Balamani ma'am, over to you.
Thank you, Dr. Neetu, and good evening, everyone gathered over here. And first of all, I congratulate the UPSMO for taking this initiation in conducting a webinar, and especially Dr. Neetu for that effort. And before going into the topic of clinical teaching, I would like to appreciate few points discussed before by the senior speakers, Dr. Priscilla Madam. Yes, I do agree, Madam. The seniors, we become the seniors, whereas we fail to prepare the lesson plan or we omit to prepare the lesson plan. First point, and second point is sometimes we prepare the lesson plan which was prepared well in advance, in previous days, whereas we fail to update. So these points really that we need to appreciate and we need to correct it. And again, I really want to appreciate the few points given by Dr. Sheila Tiwari ma'am in lab demonstration, where usually we do the mistake of all the preparations and all we do, but never we replace. So these replacement, again, it makes a very important point in our lab demonstration, because we just teach biomedical waste management, and that part we maximum miss. And even a few points like documentation, and we the nurses are maximum not doing the documentation in a very proper way, in which way that it is expected. So with all these notes, thank you for a wonderful session before and we just had. And let's go into detail. Fine, ma'am. So again, we the teachers are here, and the audience, the target audience are already teachers and principals and associate professors. So now the question may come to you, like, why the teaching principles of teaching and principles of clinical teaching? Do we not know? The question can be answered with a research which was conducted in Western Cape, that's South Africa. The topic was utilization of the teaching strategies among nurse tutors in Malawi nursing colleges, that is in South Africa. So whereas they know that there are various number of teaching strategies that are available. Next, please. Next, ma'am, please. So madam, could I have the next slide, please? Yeah, thank you. So the objective of this particular research was identifying the teaching strategies among the nursing tutors, various nursing tutors, and the various teaching strategies. Whereas what happened, the results of this was, it was amazing, where direct teaching strategies like lecture method are very common. There is no doubt about it. But also nurse tutor prefer to combine with other interactive instructions, which already is in their knowledge level. All the tutors were aware of the clinical teaching. But where comes the problem is that the ability to use the different teaching strategies, competency is still very limited. That is where the point has to be noted, that the competency of using various strategies is again limited. So this is the real reason for making it's an eye opener for us to know that. Next, ma'am. So again, we'll go, ma'am, next slide, please. Yes. Today we are going to see the clinical teaching in detail, the type of clinical teaching and all those things. Yeah. Definition, philosophy, and various methods of clinical teaching, including nursing clinic, nursing care conference, nursing rounds, and nursing care study, which we are already using. So not in detail regarding the theory or how it has to be conducted, we are going to see, but in which way that we people make mistakes or we fail to implement in a perfect way, that we will be discussing today. Next, ma'am, please. Next slide. So clinical teaching, again, the concept of clinical teaching is due to the gap between the theory and practice. So long back, like we are telling about bridging between the theory and practice, whereas the implementation point of view, it's not much happening, because first of all, the distance between the hospital and colleges, it's very high, or sometimes the parent hospital is not available in many of the institutions. And the second one is that even if it is, the parent institution is available also, that this is not implemented in a well-structured way. So these are the 2 points why the clinical teaching is not much prevalent and effectively taken place in our nursing. Next slide, ma'am. Ma'am, next please. Yeah. So clinical teaching, the definition that it is an individualized or group teaching to the nursing students in the clinical area by the nurse educators, staff nurse, and clinical nurse manager. Yes, please understand that clinical teaching not only takes place from the hand of the tutors or the lecturers or the teaching faculty. It has to be combined along with the staff nurses and clinical nurse managers. Then only a full package of clinical teaching can be delivered to our students. Next, ma'am. So as we are already knowing in very detail, like steps in clinical teaching, formulating objectives, we know like what are the central objectives, specific objective, what is Bloom's taxonomy, everything, how the behavioral objective should be planned, and it should be SMART objective. Yes, so we know all. But the thing is, how are we practically implementing the objectives? Like how are we formulating the objectives when we go to the clinicals? That matters a lot. And the next one is determining the student knowledge by conducting a test. So first one is formulating objectives. So beforehand, when a teacher or the teaching faculty is going to the clinical rounds or the clinical posting, the previous day itself, the objectives or the next day planning has to be done. What are the things that the students have to be known, like the prevalence of the conditions, like in terms of the medical conditions maybe, or else the equipments, what are it's available, and the type of experiences that you can teach to the students, everything that you will have to assess well in advance prior day. And you have to go evening as previously madams were discussing like regarding lesson plan. So we will have to prepare a planned teaching module for the next day's clinical teaching, and then only we will be able to make it as an effective. That is formulating objective. Next one is determining the student knowledge by conducting a test. Is it possible to conduct a test in the clinical setting? Test always, it doesn't mean that it has to be a written form. It can be a oral form. You can ask question, like few questions can be given to the students, like what it is. So these all the things will make you understand, will make the teachers understand what is the present level of the student, and based on which you can construct your level of teaching. And the next one, planning the content for what teaching depending on the student's knowledge. Yes, it's very well to be noted that we have involved very many types of students. For example, various level of students, first year, second year, third year, and fourth year. So when the teacher is in charge of a ward, we will have to understand that who is there, that which type of students are there, and which type of patients or experiences can be taught to them. So this is what the planning of what teaching include. And the next one, organizing the program. So what do you mean by organizing the program? So organizing the program, it means that there are various type of clinical teaching which we are going to discuss, whereas all that it can be one by one, which is not overlapping, or else it can be beneficial for the students. So in that way that the teacher has to organize. The next one, implementing and evaluating the session. So well in advance, the evaluation plan as well evaluation format has to be ready by the teacher, and then only you will have to implement, and please evaluate right immediately so that it will be easier for making a feedback mechanism. If the clinical teaching fails, then you can even more better do that. Next, ma'am, please. Philosophy and principles of clinical teaching. Again, you people well know about it. Clinical education should reflect the nature of professional practice, like which way that we are going, professional practice. This I don't need to explain you much more, but even then, the professional practice, what kind of level of students are there, and those people have to be given an expertise, information, or a skill in the clinical area, which reflects their professional practice. And clinical teaching is more important than classroom teaching. It is the principle, but again, it is equally and more than important, because the profession, the practical knowledge, unless otherwise if we are implementing, it is not going to be permanent. So this permanency, if you want in the nursing and its knowledge and skill, the clinical teaching is much more important than the classroom teaching. our medical college principal now, he used to say, Madam, don't take Hindi classes. Meaning what? Like, or English classes. Meaning what? Always we just sit in the classroom and we try to make the students understand. Like, imagine an experience of treating a CABG patient, carrying a CABG patient. It's not at all possible unless and until we take the student to the situation where the CABG patients are there, and you make them to touch the ICD tube, you make them to touch the endotracheal tube, and you make them to feel how does the ventilator and the artificial lung work. Unless otherwise, it's not going to be success for a nurse and the nursing profession. The nursing student in the clinical setting is a learner, not a nurse. This has to be noted by not only us, even by the hospital. Like what we are using is, when we put them into the implementation, like care aspect, they will be learning much. It's not that. It's something like you are going to gamble the life of a patient. That is what it is going to happen, where unskilled nurse or else a beginner, I can say a beginner nurse, if he or she has been put into an area where only for the learning purpose, you just give them a patient and then make them to understand by own, it's not possible. And the teachers are there for supervising as well the guidance of the student. Or else I'll tell you one more thing, it is that students are practicing under the licensure of the teacher. This is the actual meaning of 1:10 ratio. We usually speak 1:10 ratio. Why this 1:10 ratio is that, meaning all the 10 students are practicing in the hospital under the licensure, legal licensure of a teacher. That is what. So even if the students are doing mistake, and if it happens, if something happens to the patients, it is the teacher who is responsible for. So I wish all the teachers to be very keen enough to associate or to go along with the students, to be with the students completely during their clinical posting. So this is, so please don't think that the students are the nurse. The students are always learner and they are working under your licensure. I just want to reiterate. And the next one, sufficient learning time should be provided before performance is evaluated. That is again one more, like we just do demonstration and immediately we ask them to do the written demonstration on the next hand. It's not possible. When you just see the Bloom's taxonomy, the skill will not be acquired on one day. You have to get the orientation and then it has to have a multiple progress, and so you have to get the set, you have to go to the beginners aspect and you have to practice, and then only once you practice, then the skill will come. But what we the teachers are expecting from the student is that yesterday I demonstrated you the endotracheal intubation or else nasogastric tube feeding, and today you have to do. It's not at all possible. Please be very a smart objective that we will have to decide. So this will create a wrong procedure which has been understood by the patient, student, or else the purpose of your clinical teaching will never be served. Next, ma'am, please. Clinical teaching is supported by a climate of mutual trust and respect. So this is where the definition I just want to again reiterate. It is like clinical teaching will never be a complete package only if it is delivered by the teaching faculty. Because to be honest, teaching faculty, even you are a professor level, you are a principal level. For example, I'll tell you, I am good at medical surgical, but not good in midwifery, because when I just go to the clinical area of midwifery, I may fail to teach the students a perfect, because I'm not super specialized or specialized in that. So always the same thing. It is like you be at the principal level, vice principal level, professor level, whomsoever you are, but the experience and expertise of these staff nurses should be trusted and given mutual respect, be it a staff nurse of graduate or undergraduate or a diploma level, GNM level, whomsoever it may be or they may be. You have to have a mutual trust so that the ultimate aim is to deliver a full competent package, teaching package to the student. So this is what our aim should be. So mutual trust between the teacher, that is teaching faculty, and the hospital. Hospital people like certified, meaning like the staff nurses or the ward in charges or the matron or the clinical nurse managers, whomsoever. So together. And even the clinicians, nurse clinicians, not medical clinicians also, they are included. So it has to be in such a way like mutual trust, both sides it has to happen. And the next, clinical teaching and learning should focus on essential knowledge, skill and attitude. Yes, it is important. And the espoused curriculum may not be the curriculum in use. The espoused curriculum is the curriculum which has already been prepared by the specific regulatory or accreditation bodies called Indian Nursing Council, UP State or State Nursing Council, and the affiliated bodies called the universities. So all these are already made, but the clinical teaching should go hand in hand, but it should not be limited with the espoused curriculum. Meaning what, I can give you an example. Nowhere in our INC curriculum or any other curriculum like COVID is there in our curriculum. Are we not teaching? Are we not ready to teach the student? No, it's not that. So when the healthcare scenario is in a concept, curriculum and clinical teaching should go together, but it should not be limited to the curriculum. When the extra informations or a kind of news to patients are coming, it is the ultimate responsibility of that particular teacher to make the students understand the situation. Quality is more important than quantity. Of course, very important. Like it's not that how many teaching you are making, it is like how the teaching you are making and how the students are understanding or repeating it again. Next, ma'am, please. Yes. So here we are going to see a few clinical teaching methods and the implementational strategies in real what we are doing. So before seeing that, the next question is that, are we doing the clinical teaching or not? Yes, every teachers, every tutors, every principals, we are doing the clinical teaching, but without having an understanding the principles of clinical teaching we are doing. That is where we fail in achieving the objective. So let us all discuss about how the implementational point of view is in error. The first one is nursing clinic, bedside clinic that we are going to see, nursing care conference, nursing rounds, and nursing care study. These are the common type of clinical teaching we'll see. Next, ma'am, please. So the first one is bedside clinic. Please, ma'am, next. Can I have next slide, please, ma'am? I think it has gone. Previous, please. Ma'am, can I have previous, because in between one slide is, yeah. So bedside clinic, it's something, it is like to help the students to understand with a particular disease or disorder. So what exactly happens in bedside clinic is that there are two ways that you can conduct the bedside clinic. Either the group of students, it is the target is like, the approaches from the group of students with the teacher, and the target is only one patient. This is the basic scenario of the bedside clinic. So the scene can happen either in the bedside or, as the name suggests, or else when in such an area where the privacy cannot be taken place or privacy is not possible, and you want an environment where the the communication should be proper, so you can take the patient to the conference room, and then there also you can take. So the main point is that a group of students with the teachers are approaching the patient. So this is how the bedside clinic has to happen. So it is happening either in the bedside, or you can take them to the clinical care, that clinical conference room. Next, please, ma'am. So what is the main advantage and how does the teaching take place here? It is like what happened when the patients or the teacher or the faculty is communicating with the patients or talking to the patients or else doing something to the patient. So the real life experience of the patients can be understood by the student. They are the observers and they will be understanding like it has to have for the they are the observers and they will be understanding what the patients are telling, and they will be able to correlate with the studies or else correlate with the book picture. This is what exactly bedside clinic. Next, ma'am, please. So usually what kind of patient that you will be selecting is that somewhere are typical cases, like for example, yesterday I have given the example of Parkinson's disease, but today I'll be giving the examples of even myasthenia gravis, or else the Guillain-Barré syndrome. Guillain-Barré syndrome is the one which we have not seen much because the incident itself is not much. Whereas when you see an ICU like Guillain-Barré syndrome is there, and you can just take the group of students to the ICU or NICU and the Guillain-Barré syndrome, you can show that the patient, how does the patient is developing the ascending type of paralysis. And you can teach them the differential diagnosis between the polio and the Guillain-Barré syndrome. So this is the way that the teaching has to take place. So that is a typical cases you can select, which is more needed for the students to understand the phenomena. And the number of students you will have to calculate. It is like Guillain-Barré syndrome incident is 1 in 1,000, whereas your students number minimum 40 to 50. So will there be possibility for the student to get this particular disease every day? No, it's not possible. So the teacher responsibility of selecting the patients in bedside cleaning is that you have to select a typical cases where this is very, very important for the students, and it is not available for the students. And the students themselves are not able to study by their own because the incidents and the practically it is not possible for them to see the cases. These are few things that the teachers have to keep in concentration. And the next one, brief history, therapy and nursing problems are presented along with the nursing care, including physical, mental and social. It's like a presenting case presentation that the teachers have to do. So here, what next, ma'am, please. Can I have, yeah. So here, who has to conduct the bedside clinic? It is together the clinical side, the clinical teaching on the bedside clinic has to be conducted by the teaching faculty, the ward in charges, and or the clinicians together. It has to be conducted because the contribution will be from the theory side and from the practical side and from the experience side. So all these three, when it is coming together, it will deliver a full information to the students. And the next thing is that I just want to discuss, are we not doing this clinical bedside clinic? Yes, we are doing. But what are the mistakes that we are doing when implementing this bedside clinic is that, first of all, the teachers are not always associated or else accompanying the student. The teachers go to the clinic, whereas we just take the attendance and then or else, oh, ye karo, wo karo, wo karo. Bas utna hi hai. But after that, we never be with the students and we are not available for them throughout their clinical area or clinical hour. That is the first mistake that we are doing. Not all the people, like somebody. And the second point is that we fail to choose the patients for bedside clinic. Like it is the teacher who is accompanying the student should understand the total number or total census of the ward and the type of the patients who are there admitted in that particular ward. So then only you will be understanding which case you can select, because the highly priority cases, as we have previously discussed, like high priority cases, low incident and high importance cases, which is not possible for the students to study by their own. So on these notes, you can select the patients. So second point where we are doing mistake is that the teachers fail to select the cases. And the third point is that clinical presentation, like the teacher herself should present the case to the students. Whereas what we are doing is clinical presentation should be done only by the student. When the clinical presentation is done by the teacher, it is called bedside clinic. But we never do that. So we just ask the students themselves to present, whereas the information is not full. I told you the students must be observer. Whereas in practical, what happened, the teachers become the observer, taking the observer role instead of students. So these are some mistakes that we are doing in conducting the bedside clinic. If these mistakes have been cut, then completely your purpose will be served. Next slide, please. And the next mistake that what we are doing is that any teaching should have a course or a process. It means that in the clinical teaching, whatsoever it may be, whatever the type it may be, briefing, teaching, debriefing. As like in demonstration, briefing, demonstration, and debriefing. So here in bedside clinic, what we have to do is, I told you previous day itself, you have to formulate the objectives. So, tomorrow I'm going to teach the Parkinson's disease. So what you're supposed to do is, like, you have to make the students to learn about the Parkinson's and assessment of Parkinson's disease. What are the things that you have to expect from a patient? So you have to tell them. So when you are asking the student to come nearby, just give them 5 minutes time. Yesterday I told you to read this. So you please observe the patient for 5 minutes without speaking, without doing anything, and then you just talk to me like that. So you give them a silent 5 minutes, so that what happens, the students will have a procession, like the time for processing in their mind what they have studied in book, whereas what they are seeing in the present picture. There, somewhere around 20 to 25% of the learning will take place. And after that, then you start asking the students, yes, one by one. So on this note, every student will have a chance to present their point of view, which is from the book picture, and that you will have to correlate with the patient picture. So there, the learning becomes permanent. Even 100 years after, you cannot resist the student telling the proper information about that particular disease or the condition. This is another. And the next one is that debriefing we fail. That is, briefing also we fail. And the next one is debriefing also we fail. What is debriefing? Debriefing is that the actual teaching takes place, clinical teaching takes place, but the summary or the conclusion or the discussion is not at all taking place. That is what we just finished, and the teacher comes away from the ward. No, it should never be done like that. After making the patient comfortable, you have to take the group of students in one place, and then talk to them what and all that you have learned. And next day, again ask them what all the things yesterday you have learned. Did you remember? So it is the area where we are failing, that is briefing and debriefing. When briefing and debriefing is failed, the actual content of the clinical teaching will be in only short-term memory. And it will not go to the short-term memory. It will be only an immediate or intermediate memory. It will not be the processed to even short-term memory. This is what I would like to tell you. Debriefing is very, very important. Next, ma'am, please. Next, please. Yeah. Advantages already, like the students have the opportunity to observe, analyze, and make decisions. This is what 5 minutes you give them time. Don't speak anything, so that the decision making or everything will be processed in their mind. The students, as previously Dr. Sheila Tiwari madam was telling, the students are more brilliant. Previously, our teacher was teacher. So being a teacher, Tofir, we cannot read anything, we cannot study anything. But nowadays, the teacher's role is only facilitator, and there are so many alternatives for the teacher. Like you have YouTube, you have a website, you have what not. So all the teaching strategies come. So here, make the facilitator role and create the interest among the students. So when you create the interest among the students, and you cannot stop them learning. And even if you stop, it will not be possible. Next, ma'am, please. Next is nursing care conference. So the bedside clinic and nursing care conference, there is only one difference, is that in bedside clinic there is patient, whereas in nursing care conference there is no patient. Whereas we are discussing about the patient. So here, it is same like bedside clinic, but the patient is not usually present for the class. And this may be a method of choice when the entire group is acquainted with the patients. Like means what, like total group of students know the patient's condition well enough. So on that note, we will be conducting the nursing care conference. This is what. So here, so again, the same. Next, ma'am, please. These both are done for the purpose of evaluating the students. But evaluation is for the purpose of teacher, and knowledge acquisition is the purpose of the main purpose of the, it should be the main purpose of the teacher. The next one is nursing rounds. Before going into the nursing rounds, this nursing care conference, how are we making mistakes? It is that, are we doing nursing care conferences? Yes, we are doing nursing. Ma'am, previous slide, please. Yeah. So are we doing nursing care conferences? Yes, we are doing in the form of clinical presentation. So every year student has a requirement called clinical presentation in each of their, specialty. So how are they conducting? That makes a difference. So here what happened, that the student will be taking one case and then they will be presenting the condition. Whereas there will be a group of students, and when you are presenting that condition, those group of, like for example, I am going to present to my batchmate, that is COPD, related COPD. When I am presenting, my group student also would have come across anywhere in their class, clinical hours COPD. So it is must for the teacher to facilitate the discussion among the group regarding the COPD. That is, what are the experiences that they have had apart from this. So what happened? So, and as we know the medical field, we know that whatever signs and symptoms which is there given in the book will not be present in all the patients. Like n number of signs and symptoms given for COPD will not be there present in one particular COPD patient, whereas one patient will be presenting with a few symptoms, other patient will be presenting with the other symptoms, whereas only cardinal symptoms will be the thing. So on that note, when the student one is presenting about COPD in her clinical presentation, it is the teacher's role who is sitting as a supervisor to facilitate the discussion among the batch students regarding the experiences that they had with the other type, like other patients of COPD. So in that case, what happened? The discussion will make them understand or come to a final conclusion. Okay, so these are the picture, clinical picture that it may be available. So this area we are making mistakes or we fail in that. Next, ma'am, please. Nursing rounds. So nursing rounds is an excursion into patient's area. So are we doing nursing rounds? Yes, we are doing. I'll tell you when. So it is like when the nursing rounds are doing, like the group of patients, group of students will be going to all the patients. So all the patients' history and the basic information, everything will be noted or will be informed to the students. So this can be information giving or instructional rounds or problem solving rounds. This people, but only the mistakes or the effective way how we can make the nursing rounds, I'll tell you. How are we able to, how can we participate in nursing round? The first area is that taking over, handing over. So when the duty shift changes, the nurses give handover and the new nurse take over. So this process, you, the teachers as well, along with the students, that you will have to participate. And what happens in this is that, like the handing over nurse will tell all the information about the patient, and the taking over nurse will ask doubts regarding that patient. So this will give you around 20 to 25% of the information about that patient to your student. So this will help the teacher also to make an understanding about the patient, and in future you can teach the students, like for bedside clinic or any other area you can. So, but what we do is we never reach in time, and especially we never take participation in the handing over, taking over process. This, if it is being done, then only the nursing rounds will be possible in an effective way. First point. And second area mistake, where other area we can do the nursing round, is the doctor's rounds. So you can ask me, madam, it is nursing rounds, why the doctor's rounds? No, I told you it's a mutual respect. What happened when the doctor's round is happening, that the students have to attend the doctor's round. So what happened, the medicines or any doubts or anything which that the students are having, we have the mutual communication. But where do we fail is that, first of all, we don't encourage the students to attend the doctor's rounds. And the second one is that even if the students are attending the doctor's rounds, we, the teachers, never used to accompany. So these are the two main areas we make mistakes in doctor's rounds. We have to attend. So on that note, we can understand The remaining 10 to 15% of information about the first in nursing rounds, 25 information, and remaining 10 to 15% of the patient information can be obtained from the doctor's rounds. So with this, the clinical instructor or the teaching faculty can design the clinical teaching or which type of clinical teaching that the student need. Next, ma'am, please. So advantages, it increases the learner's learning ability, increases interest, and response to the clients is more natural. When the group of people go and then the doctors are speaking, nurses are speaking, and the response will be very, very natural and you can understand well. And yes, students can select client with specific problem and plan for the problem. This is the exact reason that the teacher or a academician should attend the rounds, either be it a doctor's rounds or the nursing rounds, but it is in the form of the rounds. Next, ma'am, please. Case method. Already we are giving the case method, but what happens in case method? Like we ask this, like even in requirements also we have clinical presentations. Apart from that, we have case study or care note or case care plan. So we give one particular patient to the students and we are asking them to care fully. But what happened? Next slide, please, ma'am. So here, what is the main aim of this case method is that when you are giving the student one case, that is from the admission till the discharge or from day 1 till minimum day 5. So the crucial period is called day 1 to day 5. The crucial period when you are making the or facilitating the students to be with the patients. So what happened? She is in an environment to learn. She has to learn. She is put into a condition to learn. This is what the basic thing of the case method. But what are the mistakes that we are doing? That I'll tell you. How we are asking the students to take a care study and we sign on day 1 itself. The final day 1 itself finished. Whereas the continuum of care is not like imparted or insisted from teacher's side. So continuum of care, what does it mean? You may be agreeing with me, like in our days and all, we used to give care minimum. We are allowed to take the care study only on Monday. And for care note or care plan, we can take only till Friday, Monday, Tuesday, Wednesday. Till Wednesday only we can take. Thursday, Friday, Saturday is a prohibited day for taking the care note, care plan, or the case presentation. Care note, care plan, or case presentation. So what happens when you take Monday, these cases on Monday, Tuesday, Wednesday, minimum 3 days, maximum 5 days, you will have to give care to the patient. And we have to, even if we are going to the clinical area also, for that case, early in the morning, 4 o'clock, we have to, that is boarding compulsory. Previously, nursing, boarding compulsory. So here we had to go at 4 o'clock or 4:30, go give the basic care and then come back, take our personal care and then again go to the regular clinical schedule. So this is, or else if we don't go and if we don't show the document, if the ward sister doesn't agree or what, anything happens, our patients will be like, our care study will be cancelled. It will be that much. So here the continuum of care is the one where the teachers are missing in the student. So the learning is not much complete. That is the thing I just want to re-insist once again. Continuum of care should be insisted from the teacher's side. So ask question daily. And the second thing is that when you are taking care of the patients, like, in care study, the student ask questions. It is like you have an aim that by the end of the care study, 5 days, that the student has to be well versed in that case. For example, I'm taking a care study of a CVA patient. By the end of the 5th day, or else by I submit the file or final care study, I have to be well in CVA. Whenever you ask question of related to CVA, I have to answer. The student has to have that objective. I mean, teacher has to have objective on student like this. So if this is happening, the clinical teaching will be perfect, complete, and 100%. And the third main mistake that what we are doing is that in care plan. In care plan, we don't encourage the students to make a realistic care plan. what we do is, like, morning she will go assess the patient, like constipation, and afternoon till 1 o'clock that she will be having posting, and she will be coming. Am I audible? I'm sorry for the interrupted connection.
Yes,
Am I
ma'am.
audible, madam?
Yes, ma'am. Please continue, ma'am.
Yeah. I'm sorry for it. Sorry for the interruption. Here, what we are doing is we just don't encourage the student to make a realistic care plan, where we just, the morning the student goes and then ask the patient's sleep pattern disturbances until 1 o'clock that she is coming. And evening she is giving you the care plan, or else next morning she is giving you the care plan, that with the evaluation saying that patient slept well, or the problem is completely, it's not possible. Overnight, it is never possible. So what we teachers are doing is that not insisting on to the realistic care. So when we are not making the realistic care, the student also will not understand the impact of the problem, and she will not make the alternative methods. For example, for sleep pattern disorder, we have a set n number of procedures, nursing procedures, and you have to make the student to implement that, and then again you ask them to give the report realistic. So what happened? At least first step now, like not in first step, not in second procedure, or not in third, at least in fifth procedure the patient will be benefited. Whereas what is your achievement is that the student has learned 5 procedures. So this is how the realistic care plan and with the evaluation will help the students. And next, ma'am, please. These are some errors that we are doing. Even if the teachers are implementing this clinical teaching, these are some errors that we are noticing. Next, ma'am, please. Yeah, this all we discussed. Please, ma'am, next. And advantages of nursing care study is that the duration. So why the 5 days is important is that you have to gain the confidence. Overnight, the confidence will never get developed unless otherwise that the content goes to the mind, then the confidence will develop. Please try it once in future or in present also, that you just give them 5 days and then ask the student to learn, repeat only one topic in the clinical, and then again ask them, how are you confident? I will bet you that confident level will be so high that even teacher will not be able to think over how that it has been developed. That is the main advantages. And next, ma'am, please. And when nursing care study is there, it is a totalistic or a holistic care that the patient is, that the student is giving to a patient, where she can be understanding all the point of view. It is a multi sectoral affair, like financial, all the things that she will be able to understand. So implications can be easily understood by the student, which is going to be a permanent learning. Next, ma'am, please. And the problem solving, and how it has to be organized, how it has to be presented, everything. So guidelines for best method. I would suggest you, like, these are some of the things that you have to note in mind, but there is no best method, there is no worst method. It is only the teacher who has to decide which is suitable for which student, and the level of student and the type of student and the mentality of the student, it differs, and the teacher and her capacity and his caliber and his presence, or the trust or the cooperation, all these matter a lot. Please, next slide. And principles of evaluation that you have to keep in mind. You are well thorough about it, that like especially documentation and principles of selecting evaluation method. Clinical evaluation format I would share with share in the WhatsApp, or else I'll give to Neetu madam, wherein in future, like she'll be sharing it, madam. I'll give the all evaluation formats, clinical side evaluation formats, including everything. Next, ma'am, please.
I really thank you for sharing your expertise with us. So स्टूडेंट्स को हम क्लिनिकल्स में भेजते हैं ताकि सिखाए गए प्रोसीजर प्रैक्टिस कर पाए एंड फर्दर सिखा पाए। क्लिनिकल सेटिंग में इफेक्टिवली प्रोसीजर सिखाने के लिए हमें ये सब प्रिंसिपल्स जो प्रोफेसर बालामणि मैम ने शेयर किया है उसको इसको ध्यान में रखते हुए और साथ ही में आर्टिकल्स अवेलेबल रहे, ये ध्यान रखें कि सब आर्टिकल्स वर्किंग कंडीशन में अवेलेबल रहे क्लिनिकल्स में भी, ताकि हम वहां पर भी जो प्रोसीजर्स लैब में सिखाए गए हैं वो हॉस्पिटल बेडसाइड में भी बच्चों को सिखा पाए, प्लस उन लोग को बच्चे फिर से डेमोन्स्ट्रेट कर पाए आर्टिकल्स को यूज करके। फिर प्रॉपर सुपरविजन करें, प्रॉपर डॉक्यूमेंटेशन करें एंड हेल्थ एजुकेशन के लिए फ्लैश कार्ड्स, फ्लिप कार्ड्स वगैरह यूज करें। तो ये सब चीजें हम इफेक्टिवली अगर यूज करते हैं तो हमारी जो क्लिनिकल टीचिंग है इफेक्टिव होगी। नेक्स्ट, आई वुड लाइक टू रिक्वेस्ट प्रोफेसर के महेश्वरी मैम टू प्रेजेंट हर सेशन। Maheshwari ma'am, over to you.
Good evening to all of you. Thank you, ma'am. Am I audible, ma'am?
Yes, ma'am, you're audible.
Okay. Kindly share the meeting. Good evening to one and all. The respected and Dr. Neetu Devi, ma'am, and all the staffs, principals, those who joined here. It was really excited, and I would like to especially give thanks to the UP faculty, those who have given a very good platform, took the first initiation to give importance as equal to the clinical for the community practices also. Since after the COVID pandemic get over, everybody started to give concentration towards the community procedures and community areas demonstration. And special thanks to Dr. Neetu Devi ma'am that she has given the opportunity for us to explain how the students can be trained in the community settings also. Thank you, ma'am. Let me start the presentation without further delay. Next slide, please. Yes, community, everybody knows who is community. We are community. Wherever one small group of people were being gathered, we used to call them as a community people only. They will be sharing some interests, they will be interacting each other, they will be collectively connected with some information, maybe with the values or without values also. So we will be calling them. And in that community, if we found, if they have any need, if they are having any problems, if we can able to do anything in their health related aspects, because you all know very well the health is not only mean with the physical status, it is a collective comprehensive care that we have to give. Like we need to concentrate on the physical, mental, social, in all the aspects we have to see. So in all the aspects, if we are identifying any needs to improve their health aspects, then it will be called as a community health. Next slide, please. Yes, and the nursing, whatever procedures we are performing, it is a collective skill only, because we are not only applying the nursing skill, we are applying the public health skill, we are applying the social skill, psychology skill, rehabilitative skill. So many skills we are combining together to give the health promotional aspect to the community people. So it is something special skill. We need to practice it in the community area. If you go through all this, almost all the teachers knows the definition of community health and the community health nursing. So I don't want to waste the time. Next, we can skip to the next slide. Yes, nurse who is performing the procedures in the community setting will be called as a community health nurse. Next slide, please. Yes, teaching with care. Here with our things is starting because everybody has been thinking teaching in the classroom, teaching in the clinical, teaching about the demonstration, everything is important. But with the same equal importance, we need to give it for the community also, because community is the heart. Because we are community, if we are well, only we can able to proceed further, we can able to take care of the people, others. So first we should know how to protect our health, and how we can take care of the means how we can prevent the illness and other thing, so that the future complications or the discomfort can be avoided. So if we start these things from the home setting, it will be easy. We need not to travel till to the hospital. So when we are teaching the students regarding the community aspects, these basic elements we need to keep it in our mind, and we have to make sure that the students are understanding the concept of community health nursing. These are all the basic elements that they have to understand. Our job is not treating the people. Our job as a community nurse, we need to promote a healthful living. That is the basic concept of community. Every student, every teacher should make sure that we are promoting the healthful living for the people in the universal. And the next step, if we are promoting, no need to go for health problems. Suppose, even though after doing all the promotional aspect also, due to the external factors, they may end up with some health problems. So how to identify that problems, how to prevent ourselves through the prophylactic treatment, or by taking some precautionary measures, how we can prevent that, we need to teach to the students. And that is the second concept we have to make sure. And then treatment, even though after taking the prophylactic treatment, precautionary measures also, sometimes we may end up with some minor to major disorders. So how to treat that one? By the early identification, diagnosis, and completing the treatment without any stop, means the successful completion of treatment. And after that, suppose if we are developing any complications due to the treatment, due to the disease condition, how to rehabilitate those people, how to make them to lead the successful life previously, how they were being in the same manner, that we need to do it in the rehabilitation measures. That also we have to insist. And of course, evaluation of health services, whatever is going implemented towards the universal, like health policies, health programs, and other important measures what we are doing, not only government, even the non-governmental organizations, what they are doing, how we need to evaluate, even our services also, how we need to evaluate, we need to teach to them. And of course, research, because day by day the universe is facing emerging disease condition, new disease conditions. As a community health nurse, we are the person who is standing in the front line, identifying the problems in the home itself, from the community itself. If we stop there, it won't be spread to the entire community. So we need to be taking a much part in the research aspect also. So these are all the basic elements we need to keep it in our mind when we are teaching the community procedures, or the demonstration, or the teaching to the students. Next slide, please, ma'am. Yes, these are all the major roles they should not forget. Maybe they have been thinking that we are not working in the clinical side. So what might be the role as a community nurse we have to do? No, we are having so many roles as a care provider. Like we can do the holistic practice as a care provider. We can do the health promotional activities, skill expansion activities. some of the procedures like performing the blood pressure checking, height, weight, like when we are reaching to the community areas, first of all, they will be asking, kindly check our BP, kindly check our height and weight. By seeing our instruments, by seeing our community back, they will be automatically asking. So we have to start this work as a care provider. So this one is not only for the prevention, even for the health promotional aspect also. And as an educator, this is a next major part as a community health nurse we need to do, apart from care provider, because most of the people, they know how to do, but they doesn't know how to do it correctly. Since how we are we might be seeing all the classes from the teaching onwards, teaching, classroom teaching, demonstration, all the way, everything we know, but we don't follow that one. So somebody should be always keep on stressing them how to do it correctly, how to do it in a systematic way. We need to teach the community people regarding the nutrition, regarding the stress management, regarding the safety, exercise, how to prevent the communicable and non-communicable disease, some common problems for the men's and women's, and how to maintain the safety, security measures, starting from the home to the occupational settings, all these things. So when we are giving the education, make sure that we are giving some aviates also to the public, so that they can carry this message in the future also. They won't forget. If we go and talk and come, but by that day they may be forgetting. If we give some aviates to them, it will be long lasting. So that also we need to provide when we are giving some health education. Next slide, please. As an advocate, because most of the time this is what the community people are expecting from the students when they are going to the community area, because most of the people, they doesn't know how to utilize the community resources properly, where to seek the guidance, where to get the help, how to enroll themselves for the health programs, or the both which was being launched by the government and by the non-governmental organization. This information we need to give it to the community people, so that they can come out and they can seek the help from them, like insurance scheme, helpline numbers, additional resources, everything we can give as an advocate, and we can be a good manager. Suppose if any problem occurs in the community, how we can plan, organize, how we can lead the group, and how to control the conflicts which is arising in and out, and how to evaluate the programs or the policies when we are conducting in the community. As a good manager, we can do this work also in the community area, and be a good collaborator. Without collaboration, nothing will happen in the community. So collaboration is another major part we need to teach to the students when they are started to work. It is not an individual work, it is a group activity. If we want to go to the community area, first we need the support from the community people. Without community participation, we can't do, and we need to have the other sectors people also, starting from the health sector, transport department, and disposable of waste, that corporations, and so many things are there. Like that, we need to integrate each and everybody, so that the people can lead a helpful life. That is the main thing, ultimate aim. If we are a good collaborator, means we can make the society as a healthy society also. And as you know very well, we can be a good leader also, that we can identify, because we know the epidemiology of the community. We know which time frame, which place, which type of, who will be getting affected, the time, place, person, everything we will be knowing, and what are the commonest problems will arise in the community, that also we know, and whom we have to give the specific attention, like vulnerable populations. So as a healthcare providers, we know this one. You take up the role and lead the group, and make them to be comfortable, and maintain their health till the end. Suppose if they are ending with problems also, we can early identify, and we can make them to start the treatment as early as possible. And of course, I told you what is the researcher role, because research, when we are maximum, almost all the teachers, those who are attending this session knows that research basically we have to do it in the community. From the community only we can identify the cause, we can identify the effect also. So more than the clinical setting, if it is the research start from the community setting, we can get many number of answers for the particular disease condition. So that's what research also taking a major role in this community part. I just briefed what are the roles are there. Still so many things are there, but when we are working on that, we can go ahead. Next slide, please. And here come, these are all the major settings. We might be thinking community area means going to the home and doing the home visit, or visiting the PHC or CHC, coming back. That's all. No, it is not like that. We are having a various areas to work. First one is a home. You know, all home visits we are doing. Villages or towns or slums, wherever we are going, we are visiting the home and we are doing all the work. And then the ambulatory care setting. Ambulatory care setting in the sense, not as an inpatient service, like morning going and evening coming back, or attending the clinics or the camps or the CHC, PHC, getting the treatment or advice, counseling, or some attending the programs and coming back. That's all. This is the ambulatory care settings. We have to work. Then the third one is schools. Of course, it is a major part. As a community health nurse, we can start to work, because if we want to do any changes in the community, means we can choose this school population, because children are the young generation. They will grab the ideas and they will be more interested towards this type of activities, and they will be transmitting the information to their entire family through. By this we can reach the entire community. So school is the best setting to give the start of the community services. And the next one is the occupational health setting. Of course, workers, all type of workers, starting from the white collar job to very heavy workers. Every occupation is having one or other type of health hazards. So as per their occupational settings, we need to teach them how to take the safety precautionary measures, how to keep the healthy environment in the occupation, because out of 24 hours, more than 8 to 10 hours we are in the occupational setting only. So that area also need to be given equal importance. And then the residential institutions, as you know very well, all the vulnerable populations used to be seen in this residential institution, starting from the geriatric population or the handicaps or by the prisoners. All these areas we will be concentrating, and we will be giving the special. Here the psychology, sociology, all these concepts we have to integrate when we are giving the teaching in this institutions. And then community at the large level, because without community we are nothing. We are only community, we are the people. So we also need to work in a large group also. The next one. So these are all the things we need to teach to the students when the community is started. This is a basic concept. This is a basic elements, settings, and the roles the community health nurse has to took her in her hand, and she need to enter into the areas. Next slide, please. Here I'm sharing some of the pictures where and all the community health nurse can work. She can do it in the school. You can give health promotional activities, educational activities in the centers like CHC, PHC, health centers, and all the area. Next slide, please. Yes, we can do some health checkups also, and we can teach the students, because I told you school is the best place to transfer the health information. If you want to make any changes in the community, start it from the school. And here comes some of the health promotional activities, what we are doing it in the community area, so that the people will start to do these practices. Okay, next. and how to do the primary prevention like regular checkups, immunizations, all this thing. Next slide, please. Health screening activities, identifying the high-risk population like anemia. Here we are doing anemia testing, hemoglobin testing, and screening the people with thyroid problems and other thing. Yes, next through the camps and other thing. And distributing the supplements if we are identifying. Yes, next slide, please. Previous one, ma. Previous one. Just go back. Little one more slide. Yes, these are all the diagnostic measures we need to do it in the community, means starting from sputum collections and swab test, all this thing, to identify the disease condition as early as possible so that we can start the treatment and complete it without any gap. Next slide, please. And geriatric care, because almost in the community, when we are reaching to the home, school children will go to the school, people, adults will go for the job. Ultimately, we used to get only the geriatric population in the community area. Here, if we have to, because they are also need to be given more concentrations of geriatric care. So these are all some of the educational activities we can do it in the community area. So coming to the basic community procedures which need to be carried out in the community area without fail. So the first one is community survey. When we are entering to the community area, make sure that we are starting with the community survey. Without community survey, we don't know what is the basic topography or the geography of the community area, where to go, where we will get more number of people, all this thing. So the community survey need to be done. I will explain each and everything one by one. Next, we need to do the family survey. After the community survey, family survey has to be done. When we are doing the family survey, we need to do the assessment of various age group, those who are in the family, especially if we are having antenatal and postnatal mothers, that assessment has to be done. And if we found any persons are suffering with any minor ailments, we can treat them in the community itself, meaning in the home itself, by using our community bag. And we need to give health education. This is a basic thing we need to do it in the community. And of course, full health assessment, because in the community, we will be having everywhere the schools, so school health assessment and the program has to be done. And we need to concentrate on the nutritional aspect of it, because all these things are all the major part of health promotion and prevention of illness. That's why. Next slide, please. Yes, community survey. How to do the community survey? So how we have to describe the allotted villages. This is the basic thing. First, we used to initiate. The first thing we need to describe the place and the physical characteristic of the community. Whether it is a seashore area, whether it is a hilly station or backward station, whether it is a center of the city or town, village, urban, slum, whatever it is, what is the physical characters, and the topographic, what are the physical and natural settings in and around the village. Then the social structure, the culture, caste, creed, all this thing, because based on the social structure only the people have been interconnected. So when we are giving some health education, health promotional activities, without knowing their social structure, we can't proceed further. So social structure of the particular village is very important. And moreover, you might be seeing some people, in the community, they will be restricted to go from one area to another area, from one street to another street, like that and all. So what is the social structure of the village that we need to collect the information? And then the political structure. Without the political support, we can't do anything in the community, because more than we give some information, if the known person and like a ward member or the Gram Pradhan or the women leader, youth leader, like this people, if they are coming out, they will be much more close with the people. So it will be easy for the community nurse to pass the health information to the entire people. So political structure, of course, we need it, and the demographical demography of the particular village, the population status, how many how much population is there, all this thing, and then the communication and education facility in the particular community very important, because if we want to do any pass any information, first of all we need good communication mode. So for that we need to know whether the people have been having good communication facility like telephones, mobiles, or how it can be reached to the people. Sometimes during the pandemic or during the lockdown periods, in that time and all, this communication is will be playing a major role. Even the education, how many schools, colleges and the institutions were there to provide the information. So this also needed. Next slide please. And the health information, including the total population, male, female, under 5, birth rate, death rate, especially the infant mortality, maternal mortality, eligible couple rate, to identify how many how many people need the family planning services and other things. So for that purpose, we need to collect this information also. Next slide, please. Yes, area map, very important, because if we have been knowing this map only, we can able to travel. Like a Google, we need to have the survey map. We need to prepare the road map, where we are starting, where we are ending, where to start, where to end, and which area we need to give the more concentration. So for that, we need to locate the distinct place like schools, temples, mosques. So where these areas only the people used to be gathered more, we can have the people density, population density more, so we can pay more attention towards this area. So we need to highlight and we need to point out these areas when we are preparing the map. And ultimately, the last one, we need to identify the social needs and problems in the particular community. This is coming under the community survey. Next slide please. This is a sample area map which was being prepared by our students. Next. Roadmap means from our college to the particular village, how we need to. So here the students are highlighting the important locations where they have to pass it and go. Yes, next slide please. And the next thing, because when we are entering to the community, first we need to know the community, then how many health institutions are there in this particular area, whether it is a village or a town or whatever it might be. Definitely there will be one PHC or CHC or the health wellness center or the sub center will be there. So we need to teach to the students how to describe this PHC, CHC or sub center. So we need to first find out what is it through the introduction and by the infrastructure. Basically, we know how the PHC has to be has to have the basic infrastructure, or the CHC has to have. So teach the students also the same thing and make the students to make the physical layout of the particular PHC or CHC, and the staffing pattern as per the government order, Indian public health standard, whether the staffs have been there or not. Students also should compare both the book picture and the real pictures, and the main functions. Because PHC, CHC, sub-center, health wellness center, each and every health institution is having some main functions which need to be carried out. Whether it is going on or not, the students also need to check, and they have to write it out, and they should know how many records and reports they are maintaining in each health institution, like PHC, CHC, and sub-center. Like CHC and all, it will be inpatient, outpatient, all these things will be there. Whereas in the sub-center or in the health wellness center and all, mainly the immunization record, assessment like antenatal, postnatal, minor alignment treatments, injection, distributing the medications, like this only they will be maintaining. So they should know in each setup what type of records and reports they are maintaining, and the activities. Starting from the Monday to Saturday, what type of activities is going on in each health institution. Like if it is a PHC, Monday, what will be the things, whether it is immunization day, whether it is antenatal checkup day, whether it is a normal morbidity clinic, everything they have to know that mortality and morbidity clinic, that what is that, special school health programs, all these things, they will be having some time schedule. So that activities, the students also should know. If it is a immunization day, we can post more students in the CHC or PHC so that the students will learn how to give the immunization. Suppose if it is an antenatal checkup day, means we can post the students in the OPDs or in the labor rooms, and means in that particular area, so that the students will get exposed to that particular procedure. So we need to know about the activities also. Then if it is a PHC, how many villages have been attached in the particular PHC? If it is a PHC, how many, if it is a CHC, how many number of PHCs have been attached in the particular CHC? We should know that one. And then there are organization chart, which will be giving the clear-cut clue to the students, how many staffs, how many pharmacists, radiographers, medical officers, whether they are the allopathy doctor, Ayurveda doctor, dentist is available, whatever it is, they will be coming to know that through the organization chart, so that when they are reaching to the community area, when they are going for the home visit, they can do the referrals to the particular CHC or the PHC or to the health wellness centers or to the CHC. Through this organization, they know what services are going on in the particular institution. And of course, the physical layout, so that they will come to know where the OPDs are there, where the diagnostic centers are there, where the inpatients will be treated, where the emergency ward is there, where the records and reports will be made, and where the medications will be issued. All these things, the students will come to know that by knowing the physical layout. Yes, next one. So after finishing all these basic procedures, next we need to go ahead with the family survey, and using the family folder, we need to do this family survey. So this family survey is the ultimate key. The nurse used to have it in her hand to treat the community people. So it will be having all the information from the top to bottom of each houses. So when we are sending the students to the community area, we will be allocating the houses, like 5 houses, 10 houses, like group of people, 5 to 6 members. If we are allotting, means each students to 2 houses. If we are putting also 5 students, they can per day 10 houses, they can complete the family survey. Like that, we can complete the entire community survey. So cumulatively, they can give the report about the particular community area. So what are the things we need to include when the students are going for home visit, especially when they are doing the family survey? The general information, like the head of the family, name, age, sex, whether it is urban area, rural area, house number, ward, block, all these things will come under the general information. And the demographic characters, that is the family profile, like starting from the head of the family, then the wife, children's, in-laws, whoever is there in the family, as per their age, sex, educational status, occupational status, their economic things, whether they are workers or they are housewife, students, and their health status also, whether they are healthy or whether they are the vulnerable population, like the school children, newborn, under 5, everything we can include it in this demographic character, so that we can pay attention individually when we are going to the community visit. Then the dietary habit of the family, whether vegetarian, non-vegetarian, all this thing. And the environmental factors, which is very important to identify whether the people are at any risk with the environmental sanitation measures, like housing, cooking, water supply, disposable of waste, and other things. Then the pet animals, because almost all the villages will be having the pet animals. They will be having sometimes inside the house, sometimes separate places will be there, whether they are maintaining the hygiene, whether the immunizations and other things were being given, the disposable of waste, whether they are doing it properly, any breeding of flies, mosquitoes are there, everything we can assess it through this thing, because vector-borne disease have been playing a major role in communicable disease. So we need to concentrate on this aspect also. Then the nutritional status. especially for the vulnerable population. If you found any antenatal mother, postnatal mother in the home, newborn, a toddler, under 5 children, school-going children, especially adolescent male and female, because they also need to be given equal opportunity, because most of the time we used to ignore this adults, males and females, because if we ignore these people, how they will bring the healthy offspring in the future. So we need to give concentration for the adolescent age group, adult group also, geriatric populations, and any people, those who are affected with acute and chronic illness in the home. So all these people, nutritional status, we need to check it out. And then their socio-economic conditions, because if we come to know about the socio-economic condition only, we can educate the people how much they can spare for the health promotional and preventional activities. Suppose if they can't able to spare the money, or if it is a daily wage family, only 100 rupees, 200 rupees they are earning per day, means how they will be spending money for the health checkup and all this thing. In that case, we can refer the people. We can show the way how they can get the guidance from the government, like this Ayushman Bharat schemes and other health schemes and all we can introduce, so that this socio-economical condition will give a clear-cut clue for the community nurse to do the referrals, guidance, counseling, all this thing related to the health resources. So don't forget to include this socio-economic condition. Then the maternal and child health, very important things. When the health commission was formed by the government of India, the first importance was being given for the maternal and child health only, because if maternal and child health is proper, the entire country will start to lead a health pathway. Because if we are not giving concentration to the maternity aspect, then we can't bring the healthy baby. If healthy baby is not there, no future in the citizenship of the particular country. So we need to give concentration for this. In this maternal and child health, which is including some basic components like antenatal mothers, postnatal care, regular checkup, proper registration, immunization, identifying the eligible couple, teaching them regarding the family planning and other things. All these aspects need to be included when we are concentrating on maternal and child health concept. And coming to the communicable and non-communicable disease, very important, because if we come to know any one person is affected in a particular family with a communicable disease, surely the chance of spreading the infection to the entire family, from the family to the community, from the community to the entire society and nation. So that we need to give more concentration. Don't forget to ask question regarding the communicable disease. Of course, non-communicable disease also playing the major role nowadays. Almost if you take 100 population, 99% of the people either affected with the diabetes or hypertension, cholesterol, vision, asthma. So many problems are there. So we need to give concentration on this one also. Then the vital events which is present in the particular year, like a birth, how many birth happened, how many death happened. Death happened means whether it is a natural death or people are died due to any disease condition, or it is accidents or other thing. Even the accidents will give you the clue whether the community need to be developed or not. So that we need to give concentration. And then the newly married couple for the family planning things. And then we need to identify the needs and problems of the particular family individually, starting from the head of the family to the last person in the family. What is their need? What is the problem? Not only physically, even the environment, dietary pattern, nutritional aspect, safety and security, everything we need to give attention, and we have to identify the needs and problems. Based on that, we can start the health education. We can take the role as a health provider, care provider, and we can do all sort of major roles what I have described in the previous one. Next slide, please. This is a sample family folder what we are using when we are sending the students to the community area. This is like an envelope which will be like a packet, like a file it will be, which will be having all the details of the particular house, starting from the house number, town, villages, the basic informations, the family profile. Next slide, please. On the back side, we will be having the economic status and the major health problems which need to be concentrated in the particular family. And it is like an envelope type. So we will be having all the assessment based on the record of services, whatever health problem we are identifying, we used to keep the assessment format inside the envelope. Like if we are having the antenatal mother, antenatal assessment format, postnatal mother, postnatal, immunization for the babies, like that we can go ahead. So this is a sample picture of community survey and family survey, what we are doing it in the community area. Next slide, please. And of course, health assessment has to be done, but it is very specific when we are doing the family survey, starting from the newborn, under 5, toddler, school age assessment, adult, male and female, antenatal, postnatal, geriatric assessment. I think I need not to explain all this thing. How to do this assessment? But specifically, each and every person need to be given concentration. Yes, next one. This is some sample pictures, how we are doing the assessment in the community area. Yes, next one. Next slide. Next slide. Yes. How to treat. So assessment over. Now, if we identify any minor elements in the family, how we can do the treatment in the community area using our back technique procedure. That is the next step we have to move. Like these are all some of the basic procedures we can perform in the home setting, like temperature checking, TPR checking, wound dressing, injections like giving the TT, like insulins, all other basic medications, urine analysis to check the albumin and sugar level, pediculosis treatment, especially when you are finding out in the school and Anganwadis, scabies treatment. Almost all the children's in the villages used to have eye irrigation for the newborns, toddlers, and other people. Oral medication, how to be administered, like starting from deworming tablets, malarial tablets, anemic tablets, folic acid, all these things we can. And hemoglobin assessment, very important, because almost 99% of the children's and the adolescents have been suffering with anemia. So that is very important. So now we are proceeding towards the back technique procedure. Next slide, please. So this is one sample bag. We used to carry it in the community area when we are going to going for the visit, and some of the articles which is very necessarily to be kept in the community bag. Next slide, please. So what are the articles need to be kept in the community bag? These are all the essential things need to be kept. The outside packet should have the newspaper to spread it and start the procedures, because we can't keep the community bag in the floor. We need to spread the mat or dari if people are having. Otherwise, on top of that, we need to spread the newspaper on plain floor, and we have to start. Stationaries like pen, paper, all this thing, family folders, now what I have showed, flashcards to give health education, waste paper bag to collect the waste after the procedures, a small Macintosh or a plastic sheet or a plastic apron to wear when we are start to give some infected procedures. And it will be having both side 2 packets. So left side and right side. So the left side packets will be containing some essential basic medication. If you are finding any person with the fever, any infection, any eye irrigation need to be done, means all these basic medications we can keep it in the, because these are all need not to be given with the doctor's prescription. Even the community nurse can prescribe and do that. We are having the standing order for giving the prescribing this type of medication. So this essential medications we can keep it in the community bag. So who they need for the emergency purpose, don't give it in a bunch of tablets and other things, like one time or 2 times they can have it, and we have to send them to the, refer them to the nearby PHC or CHC for the further treatment. Fetoscope for assessment, inch tape, Saget tape, and spring balance, all this thing to do all the basic assessment, and hand washing materials, hand towel, soap dish, nail brush, and sanitizer must after the COVID. And the lower compartment, which is carrying the clean articles like urine analysis kit, specimen bottles to connect the specimens, kidney tray, test tubes, test tube holders, sprit lamps, and the stethoscope, all these things. Okay, then the inner side, it is a sterile compartment. Always it will be considered as a sterile compartment, and it has to be handled very carefully. When we are teaching the back technique procedures, we will be teaching the scientific principle, how to open, how to close, all this thing. In that time, we need to give more concentration on this inner sterile compartment, where the dressing articles have been used to be kept, like artery forceps, thumb forceps, scissors, bowls to pour the solutions, glouses and the solutions, clinical thermometers, dressing packages like cotton gauze, roller bandages, and some mucus extractors or disposable syringes. All these things we can keep it inside the sterile compartment. Yes, next one. And this is, of course, before sending them to the community area, we need to teach all the procedures, whatever I told, like starting from TPR to last hemoglobin checking. The checklist has to be provided to the students. So based on the checklist, the students has to do the procedures when they are performing it in the community area. Next slide, please. So how to do the procedures? Each procedure is having a unique way of carrying the articles and other thing. This is a commonest general thing how we need to do the back technique in the community area. So first we need to prepare ourselves, like wearing the apron, pin up our hair, remove the ornaments and other thing, hand washing before and after. This is very important before starting the procedure. Next slide. And we need to select the location in the house. Don't select it in the inner side, very well ventilated area where the people can be seated comfortably. That type of area we need to select, and we will ask them to spread the mat in the floor, and then we have to spread our newspaper, and then we have to keep our bag and start to arrange the articles as per the procedure what we are going to perform. Have the tell the students to keep the checklist in their hand so that they will not forget any steps when they are doing it, and don't tell the students to assume the procedures or the articles they need this one, that one, and all. As per the procedures, the articles need to be arranged, and we need to explain the procedure to the family members. They should not get fear by seeing all the articles and other things. So the explanation is very important. How we used to prepare the patient in the clinical setting, same like that we have to prepare the family members also before starting the procedures in the community area. We need to explain when we are doing the demonstration with the reason. Then next. And after completing the procedure, clean the articles, replace it in the community bag. Usually after procedures, the articles used to be kept in the lower compartment. After doing the sterilization, it should be kept in the inner compartment, sterile compartment. Suppose if we are using any dressing, doing any dressing or injection techniques, anything if we are doing this. And then don't forget to do the documentation, because from the beginning 2 o'clock onwards, we have been talking about this documentation, replacement of articles, and then clarification. And if students need to give any health education or anything, that also can be given. These are all the things we need to keep it in our mind when we are doing the post procedure. Next slide, please. So once we complete the procedure, the next thing is health education. This is the major things as a community nurse. We need to do it in the community area. We can give a health education to the individual people also, like some of the health education, like how to prevent the sexually transmitted disease. If you find any HIV patients, leprosy patients, like this people and all, we can give individual health education, so that because the social stigma will be there. If we are doing all this thing in the group level, they won't give concentration towards, they will be afraid to ask the questions and other things. So that need to be avoided. And group health education and mass health education, of course, for all the health promotional and preventional aspects, we can do it as a group and mass health education. Next one. These are some of the pictures, how the students are performing the things. And don't forget to give the AV8s. When we are giving the health education, don't forget to give the AV8s, because this will help them to retain the message in the future, and they will do the follow-up. So it is very important to give the AV8s messages, informations through the pamphlets, leaflets, notice, anything in any manner we can give to the public. Yes. These are all some of the pictures, how the students have been performing the health education in the community area by using the ABS. Next slide, please. And don't forget, I told you this is a major setting next to the home setting. School setting is a much importance we need to give in the community area, so that maximum problems, health problems, can be avoided for the future generation. So this is some of the sample pictures how the school health assessment can be done. And cooking demonstration, of course, we have to do it. I think I covered everything in the community aspect. Thank you so much for your patience listening. Thank you so much.
Thank you, ma'am. Thank you, ma'am, for your sharing your experience and knowledge on this topic. जब हम स्टूडेंट्स को कम्युनिटी पोस्टिंग के लिए भेजते हैं तो वहाँ कुछ प्रोसीजर्स भी करके दिखाने होते हैं. उसके लिए कम्युनिटी बैग विद फुल आर्टिकल्स होना जरूरी है, क्योंकि बिना आर्टिकल्स के हम सही तरीके से प्रोसीजर्स डेमोन्स्ट्रेट नहीं कर पाएंगे. साथ ही में हेल्थ एजुकेशन देते समय एविएट्स का इस्तेमाल करें. रोल प्ले, स्कूल हेल्थ प्रोग्राम्स, कई ऐसे एक्टिविटीज बच्चों स्टूडेंट्स को करवाएं ताकि और भी बेहतरी अच्छे तरीके से बच्चे सीख पाए. जैसे क्या एक्टिविटीज करवा सकते हैं, साथ ही में डॉक्यूमेंट भी कराएं. जो भी एक्टिविटीज हम करवाते हैं उसके साथ साथ डॉक्यूमेंटेशन भी मेंटेन करवाएं और सिखाएं बच्चों को. Now, on behalf of UP State Medical Faculty, I would like to thank all the speakers, owners and principals and their faculties for your time. Now, let us, all of us, bring a change in students' life by providing them with effective teaching in nursing education, whether that may be in the classroom or in the lab or in the community. Once again, my sincere thanks to one and all. Thank you.